The overhead lights in Trauma Bay 3 buzzed like dying insects as Dr. Marcus Webb slammed his clipboard onto the stainless steel counter. "You're a nurse," he said, his voice dripping with contempt. "So why don't you stick to changing bedpans and let the people with actual medical degrees handle the thinking?" The woman standing across from him, pale skin, exhausted gray eyes, a faded scar barely visible above her collar, said nothing. She just stepped back into the shadows where she'd spent the last 6 weeks making herself invisible. But what Marcus Webb didn't know, what none of them knew, was that the quiet woman they dismissed as just another floor nurse had once been known by a very different name, a name whispered in field hospitals across 2 war zones, a name that made seasoned combat medics stand a little straighter. And in less than 8 hours, when blood covered the floors and the hospital descended into chaos, they would all learn exactly who they'd been ignoring. Stay with me until the end of this story. Hit that like button and drop a comment with your city so I can see how far this journey travels. Meredith Cole had perfected the art of being invisible. She kept her head down during morning briefings at Riverside General Hospital in Portland. She triple-checked her supply carts without complaint when the day shift nurses left things a mess. She swallowed every condescending comment from physicians who barely glanced at her name badge before barking orders. 6 weeks into her transfer from a small rural hospital in eastern Oregon, she'd learned that survival in this level 1 trauma center meant staying quiet, staying useful, and never, ever making waves. The military tattoo on her left shoulder, an eagle clutching a medical caduceus, stayed hidden beneath her scrubs. The commendations boxed up in her apartment stayed there. The nightmares that still woke her at 3 in the morning stayed locked behind her ribs where they belonged. She was just a nurse now. That's all anyone needed to know. "Cole!" The voice cut through the nurse's station like a blade. "Where the hell are my pre-op notes?" Dr. Marcus Webb stood at the main desk, his surgical cap pushed back, his face flushed with the particular shade of red that came from too much coffee and too much ego. At 42, he'd built a reputation as Riverside's most talented and most insufferable cardiothoracic surgeon. Staff called him the Shark behind his back, though never within earshot. He'd gotten 3 nurses transferred in the past year alone for what he called performance issues, and what everyone else recognized as refusing to tolerate his abuse. Meredith grabbed the folder from the rack. "Right here, doctor." He snatched it without acknowledgement, flipping through pages with barely a glance. "This patient history is incomplete. I documented everything the intake nurse. I don't care what intake did. I need a complete workup before I walk into that OR, and you're the one who's supposed to make sure I have it." He shoved the folder back at her chest. "Fix it. You've got 20 minutes. She took the folder. "Yes, doctor." He was already walking away. "And someone tell Dietary that if they send up another tray of cold coffee, I'm going to start naming names in my incident reports." The charge nurse, Angela Torres, waited until Webb disappeared around the corner before exhaling slowly. "One of these days, someone's going to drop a piano on that man's head." "Get in line," muttered another nurse. Meredith said nothing. She just opened the folder and started cross-referencing the patient's medication list against their chart, her pen moving in quick, efficient strokes. She'd dealt with worse than Marcus Webb. Much worse. At least he couldn't actually shoot her. The morning blurred into the usual chaos. A 16-year-old motorcycle accident victim arrived with a shattered femur. An elderly woman with chest pain turned out to have a dissecting aortic aneurysm and got rushed to surgery within minutes. A construction worker came in with a nail gun injury that looked horrifying but turned out to be mostly superficial. Meredith moved between patients with the same quiet efficiency she brought to everything, checking vitals, updating charts, anticipating what the physicians would need before they asked. Around 11, Webb emerged from his surgery looking smugly satisfied. "Textbook valve replacement," he announced to no one in particular. "Patient's already showing improved cardiac output. I'd say we're looking at a full recovery." He caught Meredith restocking a crash cart nearby. "Cole, next time I need pre-op notes, I expect them to be complete the first time. I don't have time to babysit inadequate documentation." She kept her face neutral. "Understood. Do you? Because I'm starting to wonder if they taught you people anything useful out in the sticks." He grabbed a tablet from the desk. "Where'd you transfer from again?" "Water Regional. It's a small hospital in I know where it is." "Population what, 3,000? You probably saw more tractor accidents than actual trauma." He didn't wait for a response. "Well, you're in the big leagues now. Either step up or step aside. Angela caught Meredith's eye after Webb left, mouthing asshole with exaggerated lip movements. Meredith managed a slight smile, but inside she felt the familiar cold weight settling in her chest. The same weight she'd carried since she'd left the service. Since she'd walked away from the name, the rank, the life that had defined her for 8 years. Captain Ava Winters didn't exist anymore. Only Meredith Cole. Just a nurse. Just invisible. The afternoon shift brought a steady stream of patients. Nothing critical, just the usual broken bones, chest infections, and minor emergencies that filled a metropolitan trauma center. Meredith was checking on a post-op patient in recovery when she heard raised voices from the surgical wing. "I want her removed from my team." Webb's voice carried down the hallway with perfect clarity. Meredith froze outside the recovery room door. "Marcus, that's not how staffing works." That was Dr. Patricia Lindholm, the hospital's chief of surgery. Her voice stayed measured but firm. "You can't just remove nurses because you don't like their attitude. It's not about attitude. It's about competence. That rural nurse you brought in, Cole, she's not ready for this level of care. She second-guesses everything, she's slow to respond, and frankly, I don't trust her judgment in critical situations." Meredith's jaw tightened. "I've reviewed her performance reports," Lindholm said. "She's exceeded standards in every category. Her response times are actually faster than, on paper, sure. But I work with these people in real-time, life-and-death situations, and I'm telling you, she's a liability." His voice sharpened. "Either move her to a different unit, or I'm going to start documenting every mistake she makes until you have no choice." There was a long pause. "I'll speak with her supervisor," Lindholm finally said. "You do that." Footsteps approached. Meredith quickly slipped into the recovery room, her hands suddenly busy checking IV lines she'd already confirmed were functioning perfectly. Her heart hammered against her ribs. Not with fear, she'd lost the capacity for that kind of fear years ago, but with the bitter recognition of a battle she couldn't win. Webb had power here. Connections. A reputation that insulated him from consequences. She was just a nurse with a fake smile and a hidden past. By late afternoon, Angela found her in the supply room, restocking shelves. "You okay?" Meredith didn't look up. "Fine. Webb's on a warpath today. Don't take it personally." "I never do." Angela leaned against the doorframe. "You know what I heard? Before you came here, you worked in some overseas medical program. That true?" Meredith's hands stilled for just a fraction of a second. "Something like that. Must have been intense. Different from this place?" "Very different." "Well, for what it's worth, I think you're doing great. Webb's just intimidated by competent women." Angela grinned. "He went through 3 divorces before he turned 40. That should tell you something." Meredith allowed herself a small smile. "Thanks." After Angela left, Meredith stood alone in the supply room, surrounded by neatly organized shelves of gauze and syringes and surgical tape. The overhead fluorescent buzzed softly. Somewhere down the hall, a monitor beeped in steady rhythm. She closed her eyes and took a slow breath, pushing down the memories that always threatened to surface when her guard dropped. Sand in her boots, blood on her hands, the steady percussion of helicopter rotors overhead. Focus on now. Only now. At 6:45 that evening, everything changed. The first victim from the warehouse fire arrived unconscious, his airway compromised by smoke inhalation. Then came 3 more from the same scene, 2 with severe burns, 1 with suspected crush injuries. The trauma bays filled quickly. Residents scrambled. Nurses prepped equipment with practiced speed. Webb took command immediately, directing resources with the kind of authoritative efficiency that had built his reputation. Whatever his interpersonal failings, he knew how to run a trauma response. Meredith was assigned to the burn victims, cleaning wounds, establishing IV access, monitoring for signs of respiratory distress. Standard protocol. She moved through the tasks with mechanical precision, her mind clicking through checklists the way it always did under pressure. But something felt wrong. The third burn victim, a man in his 50s, unconscious and intubated, had vitals that didn't match his visible injuries. His blood pressure was dropping despite aggressive fluid resuscitation. His oxygen saturation kept dipping even with supplemental oxygen. The attending physician attributed it to smoke inhalation trauma and ordered another round of medications. Meredith watched the monitor. Then she leaned over the patient, checking his chest expansion, his skin color, the way his abdomen moved with each breath. There. A subtle asymmetry in his chest rise, the faintest hint of subcutaneous emphysema crackling under her fingertips near his collarbone. Doctor, her voice stayed calm. I think he has a pneumothorax. The resident glanced up from adjusting the ventilator. His chest x-ray was clear. X-rays can miss it in the supine position. Look at his neck veins. They're distended, and his trachea is deviating slightly to the left. The resident frowned but stepped closer, examining the patient. After a moment, he shook his head. I don't see it. His injuries are consistent with inhalation trauma. We're treating appropriately. His pressure's dropping. Because he has significant fluid shifts from the burns. That's expected. The resident's tone grew impatient. Please focus on wound care and let me manage the medical decisions. Meredith stepped back. Protocol said she'd voiced her concern. Protocol said she'd done her job. Protocol said she should move on. But the cold weight in her chest grew heavier. She glanced toward the next bay where Webb was working on the crush injury patient. His surgical team moved around him like a well-rehearsed orchestra, every hand knowing its place, every movement efficient. He was good at this part, the technical part, the part where egos didn't matter and only skill counted. The monitor alarm shrieked. Meredith's head snapped back to the burn victim. His oxygen saturation had plummeted to 78%. His blood pressure crashed. The resident lunged for the crash cart, shouting orders, but Meredith's brain had already processed what was happening. Tension pneumothorax. Air trapped in the chest cavity, collapsing the lung, shifting the mediastinum, compressing the heart and great vessels. If they didn't decompress it in the next 60 seconds, the patient would arrest. She saw it all with perfect clarity, the exact spot on his chest where she needed to insert the needle, the angle, the depth. She'd done this procedure 40, maybe 50 times in field conditions with worse equipment and worse lighting. Her hands remembered the motion like muscle memory etched in bone. But she wasn't Captain Ava Winters anymore. She was just Nurse Cole, and nurses didn't perform needle decompressions without physician orders. Get me a 14-gauge needle, the resident yelled, and page the attending, now! Someone thrust the equipment into his shaking hands. He positioned it over the patient's chest, hesitating, clearly unsure of the exact landmarks. Meredith's training screamed at her. Second intercostal space, mid-clavicular line, perpendicular to the skin. The resident aimed too low. Higher, Meredith said quietly. Second rib, not third. He ignored her, pushing the needle forward, and missed the pleural space entirely. The patient's stats continued dropping. 70%, 68. It's not working! The resident's voice cracked with panic. Webb appeared in the doorway, surgical gown still on, blood on his gloves. What the hell is going on? Tension pneumo, I can't get the needle in. Webb shoved the resident aside and grabbed fresh equipment. His movements carried absolute certainty, no hesitation, the confidence of someone who'd done this 1,000 times. He positioned the needle, angled it properly, and pushed. A rush of air hissed out. The patient's oxygen saturation began climbing immediately. 72, 78, 85. Webb stepped back, breathing hard. Jesus Christ, how did you miss that on the initial exam? The resident looked stricken. His x-ray was, I don't care what the x-ray showed. You examined the patient, not the films. Webb's gaze swept the room and landed on Meredith. You. Did you notice any signs before this? She met his eyes. I suggested pneumothorax 10 minutes ago. The room went very quiet. Webb's expression darkened. You suggested? The resident disagreed with my assessment. Because you're a nurse. Webb's voice dropped to something cold and dangerous. And you think that gives you the authority to make diagnostic calls? You think a few months of nursing school makes you qualified to second-guess a physician? I was trying to help. You were trying to play doctor. And you know what happens when nurses forget their place? People die. That patient, he jabbed a finger toward the now stabilizing victim, almost died because this resident was too busy listening to your guesses instead of focusing on real medicine. The unfairness of it hit like a physical blow. The resident had ignored her, had missed the diagnosis entirely, had nearly killed the patient through his own incompetence, and somehow she was the problem. But Meredith just stood there, silent, while Webb tore into her in front of the entire trauma team. From now on, you keep your medical opinions to yourself unless specifically asked. You monitor, you document, you follow orders. That's it. If I hear about you trying to diagnose patients again, I'll have you removed from trauma rotation permanently. Are we clear? Yes, doctor. He turned back to the resident. And you, learn to trust your own clinical judgment instead of getting distracted by nursing staff who don't know their limitations. Webb stalked out. The resident wouldn't meet Meredith's eyes. The other nurses busied themselves with suddenly urgent tasks. Angela touched her arm briefly in silent support, but there was nothing to say. The hierarchy had spoken. The order had been reinforced. Meredith returned to her wound care duties, her face blank, her hands steady. Inside, though, something shifted. The weight in her chest cracked, just a little, and underneath it, something older and harder began to wake up. The rest of the shift passed in tense silence. Meredith finished her documentation, cleaned her workstation, and was preparing to leave when Patricia Lindholm appeared at the nurse's station. Cole, my office. Now. Meredith followed the chief of surgery down the administrative corridor, her stomach tight. This was it. Webb had made his move. She was about to be transferred, or worse. Lindholm closed the office door and gestured to a chair. Sit. Meredith sat. Lindholm settled behind her desk, steepling her fingers. For a long moment, she just studied Meredith with sharp, assessing eyes. Finally, she spoke. I read the incident report from tonight, the pneumothorax case. Yes, ma'am. You identified it early. The resident missed it. Dr. Webb performed the procedure, and the patient survived. Lindholm paused. That's the official version. Meredith said nothing. The real version is that you tried to prevent a crisis, got ignored because of your position, and then got publicly humiliated for being right. Lindholm's voice stayed neutral, but something flickered in her expression. And now Webb wants you gone. He claims you're a danger to patients because you overstep your scope. I understand. Do you? Lindholm leaned forward. Because here's what I'm trying to figure out. I've got a surgeon with an excellent track record and terrible interpersonal skills who wants to fire a nurse with an exemplary performance record and mysterious qualifications. Your resume says you worked for Doctors Without Borders before coming here. But when I tried to verify your overseas service, I hit a wall of classified clearances and military channels. Meredith's pulse quickened, but her expression stayed flat. I signed standard confidentiality agreements. For medical volunteer work? Some of the areas I worked in were sensitive. Lindholm studied her for another long moment. Then she sat back. I'm not transferring you. Webb doesn't get to bully staff out of his way just because they make him uncomfortable. But I'm putting you on a different rotation temporarily. Maternity ward, quieter environment, less direct interaction with surgical. It was a demotion in everything but name. I understand, Meredith repeated. You're a good nurse, Cole. Better than good, actually. Whatever you're running from, whatever you left behind. Lindholm shook her head. Just keep your head down for a few weeks. Let this blow over, okay? Yes, ma'am. Meredith left the office feeling hollowed out. The maternity ward. Delivering babies and monitoring postpartum vitals, while Webb continued ruling the trauma center like his personal kingdom. While incompetent residents made dangerous mistakes and got defended because they had the right letters after their names. She was so tired of hiding, tired of being small, tired of watching people die or nearly die because the system valued hierarchy over truth. But what choice did she have? Captain Ava Winters had died 2 years ago in a field hospital outside Kandahar. She wasn't coming back. Meredith drove home through Portland's rain-slicked streets, the windshield wipers beating a steady rhythm that reminded her too much of helicopter rotors. Her apartment was dark and empty. She dropped her bag by the door, kicked off her shoes, and made it exactly 3 steps before her phone rang. Angela's name flashed on the screen. Hello? Turn on the news. Angela's voice was tight. Right now. Meredith grabbed the remote. The local news channel showed aerial footage of a massive pileup on Interstate 84. Cars crumpled like aluminum cans. Emergency lights strobed across multiple lanes. The news crawler at the bottom estimated 40 to 50 vehicles involved. Mass casualty incident with dozens of critical injuries en route to area hospitals. Riverside General has activated its disaster response protocol. Her phone buzzed with the mass notification from the hospital. All staff report immediately. Level 1 mass casualty event. Meredith was already moving, grabbing her keys, her mind shifting into a different gear. The woman who drove back to Riverside General Hospital wasn't quite the same one who'd left 20 minutes earlier. The emergency department had transformed into controlled chaos by the time Meredith arrived. Gurneys lined every available wall space. The triage area overflowed with patients, some screaming, some eerily silent, all of them bleeding. The smell of gasoline and burnt rubber hung thick in the air. Dr. Lindholm stood at the command center directing incoming ambulances. Trauma 1 and 2 are full. Start routing to the auxiliary bays. I need every available surgeon out of bed and in this building. Orthopedics, general surgery, everyone. Webb appeared from the surgical wing, his team already assembled. For all his flaws, he stepped up in crisis. I'll take the critical chest and abdominal injuries. Route them to Bay 3. Cardio team is 10 minutes out, someone called. We don't have 10 minutes. Start with what we've got. Lindholm's eyes found Meredith in the crowd. Cole? Forget what I said earlier. I need you back in trauma. Now. Meredith nodded and moved into position. The first wave hit like a tsunami. A teenage girl with a tension pneumothorax. Meredith spotted it in seconds and had her decompressed before the attending even finished his examination. A middle-aged man with a severed femoral artery, Meredith applied pressure with perfect precision while the surgical team prepped. A woman with a crushed pelvis and massive internal bleeding. Meredith coordinated with radiology and blood bank simultaneously, anticipating every need. She moved through the chaos with an efficiency that drew stares. No wasted motion, no hesitation. Every action deliberate and exactly what the situation required. Angela caught her arm between patients. Where the hell did you learn to work like that? Practice, Meredith said simply, and moved to the next gurney. 3 hours in, they were still drowning. Patient after patient after patient, each one critical, each one demanding more resources than they had. Meredith had been working non-stop, her scrubs soaked with other people's blood, her hands steady even as exhaustion crept into her bones. Then the paramedics wheeled in a victim who made her heart stop. Male, late 20s, military haircut, dog tags visible around his neck, massive chest trauma, flail chest with multiple rib fractures. His breathing was rapid and shallow, his skin gray, his lips tinged blue. Combat injury pattern. She recognized it instantly. The attending physician, a capable doctor named Morrison, assessed quickly. Flail chest with probable pulmonary contusion. Get him to radiology for a CT, then prep for possible chest tube. Bezpeki, is... No. The word came out before Meredith could stop it. Morrison looked up, surprised. Excuse me? You don't have time for CT. He's got a massive hemothorax. Look at his neck veins. Flat, not distended. That's blood filling his chest cavity, not air. His pressure's going to crash in about 90 seconds. I'm following protocol, Chopin. Protocol will kill him. Meredith stepped closer, her voice dropping to something that cut through the chaos. I've seen this injury before. You need to get a chest tube in him right now or he's going to bleed out before he reaches radiology. Morrison hesitated. Around them, the ER continued its frantic dance, but a small circle of attention had focused on this confrontation. Another nurse overstepping, another opinion from someone without a medical degree. The patient's monitor alarm began beeping, blood pressure dropping. Morrison grabbed the chest tube kit. Fine, but if you're wrong, I'm not. He made the incision, inserted the tube, and immediately dark blood gushed out into the collection chamber. More blood than anyone had expected. The patient's pressure stabilized almost instantly. Morrison stared at the blood, then at Meredith. How did you... But she'd already moved to the next patient. The clock hit midnight, then 1 a.m., then 2. The wave of casualties finally began to slow. The most critical patients had been stabilized or sent to surgery. The walking wounded got treated and discharged. The dead, and there were dead, got covered with sheets and wheeled to the morgue. Meredith leaned against a wall in a quiet corner, drinking water from a paper cup when Marcus Webb found her. That was impressive work tonight. She looked up, surprised. He didn't look angry. If anything, he looked considering. The hemothorax patient. Morrison told me you diagnosed it immediately. Probably saved the guy's life. Just doing my job. That wasn't just a job. That was field experience, real trauma training, not textbook knowledge. His eyes narrowed. Where exactly did you serve? I didn't say I served. You didn't have to. He stepped closer. I know what military medical training looks like. My brother was an Army flight surgeon. You've got the same tells, the way you move in crisis, the way you prioritize, the speed of your assessments. He paused. So what were you? Combat medic? Field hospital? It doesn't matter. The hell it doesn't. I've got a nurse on my staff with advanced trauma skills who's been hiding it for 6 weeks. That matters. His voice lost some of its edge. Look, I was hard on you earlier. Maybe too hard. But if you've got this kind of experience, I need to know. We all need to know. I'm just a nurse, Dr. Webb. No. His certainty was absolute. You're something else. And sooner or later, I'm going to find out what. He walked away, leaving Meredith alone with her racing thoughts and the cold knowledge that her carefully constructed invisibility was cracking. The ER was finally clearing out around 3:30 a.m. when the last ambulance arrived. A single patient, stable, but requesting transport to Riverside specifically. The paramedics wheeled him in, a man in his 40s with minor injuries from the pileup, but insistent on this particular hospital. Meredith barely glanced at him as he passed. She was focused on cleaning up Bay 2, restocking supplies, trying to process the night's chaos while her body screamed for sleep. Then she heard the voice. "Goddamn ghost!" Every muscle in her body locked. She turned slowly. The man on the gurney was sitting up now, staring at her with wide eyes. Older than when she'd last seen him, grayer, but unmistakable. Staff Sergeant Davis Mitchell, combat medic, 3rd Battalion, Kandahar Province. One of the men she'd served with when she was still Captain Ava Winters. Their eyes met across the ER, and she watched recognition flood his face with absolute certainty. Mitchell's mouth opened. He was going to say something. Her name, her rank. Something that would shatter the careful facade she'd built. And standing 10 feet away, watching the exchange with sharp, intelligent eyes, was Marcus Webb. Meredith moved before Mitchell could finish the word. "Let me get your vitals checked." Her voice came out steady, professional, betraying nothing as she stepped between Mitchell and Webb's line of sight. Her hand found Mitchell's wrist, checking his pulse, yes, but also squeezing hard enough to hurt. A warning. Mitchell's eyes widened slightly. He was older, maybe 45 now, but his instincts were still sharp. He'd survived 3 tours for a reason. "You hit your head in the accident?" Meredith asked, loud enough for Webb to hear. Yeah, might have. Any nausea? Blurred vision? Little dizzy. Mitchell was catching on, his voice uncertain now instead of shocked. "Everything's kind of fuzzy." Webb moved closer. "I can take this patient if you need." "I've got it." Meredith didn't look at him. "Possible concussion. I'll run the standard protocol." She wheeled Mitchell toward an empty exam room, feeling Webb's gaze burning into her back. The moment the curtain closed behind them, Mitchell grabbed her arm. "Jesus Christ, Ghost, we thought you were—" "Don't!" The word came out sharp as a blade. "Don't use that name. Don't tell anyone you know me. Don't—" She stopped, forcing herself to breathe. "Please." Mitchell studied her face, and she watched understanding dawn slowly. The hunted look in her eyes, the desperation, the way she'd thrown herself between him and exposure like someone shielding a live grenade. "What happened to you?" "I left. That's all." "You left?" "Ghost, you don't just leave. You were—" He lowered his voice. "Half the battalion thinks you're dead. There were rumors about Kandahar, about what went down, but nobody had real intel. Command sealed everything. And you've been here the whole time? Working as a civilian nurse?" "My name is Meredith Cole." She pulled out her penlight, shining it in his eyes professionally, even though her hands wanted to shake. "I need you to follow this light. That's not your name." "It is now." Mitchell followed the light, but his jaw worked like he was chewing on something bitter. "How long have you been hiding?" 2 years. 2 years. He shook his head slowly. "Does anyone know? You're the first person who's recognized me. And that doctor out there, Webb, he suspects something, doesn't he? I saw the way he was watching you." Meredith didn't answer. She pulled out her stethoscope, pressing it against his chest. His heartbeat was strong and steady. Whatever injuries he'd sustained in the pileup, they were minor. Your breathing's clear. No sign of internal trauma. She stepped back. I'm going to recommend overnight observation for the head injury, but you should be fine. Ghost? Meredith? He caught her wrist, his grip gentle but insistent. I've known you since you were a captain pulling shrapnel out of kids while mortars dropped. You saved my life in Helmand. Saved a lot of lives. Whatever you're running from, I'm not running. The hell you're not. His voice dropped to something almost sad. You were the best combat surgeon I ever saw. The best leader. Guys would follow you into a minefield without question because they knew you'd get them out alive. And now you're what? Hiding behind some fake name, letting asshole doctors treat you like you're nothing? The words hit harder than she expected. Because he was right. She knew he was right, but knowing didn't change anything. I need you to forget you saw me, she said quietly. Can you do that? Mitchell held her gaze for a long moment. Then he released her wrist and leaned back on the exam table. You really want to disappear that bad? Yes. Then I didn't recognize you. We never met. He paused. But Ghost, Meredith, whatever you're hiding from, it's going to catch up eventually. It always does. She left him there and returned to the nurse's station where Webb was reviewing charts. He looked up immediately. What's his status? Possible mild concussion. I recommended overnight observation. He seemed to know you. Her stomach dropped, but her face stayed neutral. He was confused. Head trauma can cause disorientation. He called you something before you cut him off. Webb's eyes narrowed. What did he call you? I didn't hear anything clearly. The ER was still loud. It was a terrible lie. They both knew it, but Webb couldn't prove otherwise, and after a moment he just nodded slowly. Get some rest, Cole. You've been on your feet for 12 hours. She nodded and turned to leave, feeling his suspicion following her like a shadow. The next 3 days passed in uneasy tension. Mitchell kept his word. He didn't acknowledge knowing her, didn't use her old name, didn't give Webb any ammunition. He was discharged after 48 hours with a clean bill of health and a quick nod in Meredith's direction that said everything and nothing. But Webb was watching her now. Really watching. She felt his gaze during morning rounds, caught him asking other nurses about her background, her training, where she'd worked before Riverside. He was digging, and sooner or later he'd find something. Military records could be sealed, but they couldn't be erased. Someone, somewhere, had documentation of Captain Ava Winters. On Thursday morning, Meredith was restocking trauma supplies when Angela appeared, her expression tight. Conference room, now. Lindholm wants to see you. What's this about? No idea, but Webb's in there too. Meredith's pulse quickened. She followed Angela down the administrative corridor, her mind racing through possibilities. Had Mitchell talked after all? Had Webb found her service records? Was this the end? The conference room held 4 people. Patricia Lindholm, Marcus Webb, a woman in business attire who looked like hospital legal, and a man in a dark suit who radiated federal authority. Meredith stopped in the doorway. Close the door, Lindholm said. She did. The click of the latch sounded like a cell door locking. The man in the suit stood and extended his hand. Agent Ross Kimball, Department of Defense. You're Meredith Cole? Yes. Please sit. She sat. Her hands stayed relaxed in her lap, but every nerve in her body screamed danger. Kimball opened a folder on the table. I'm going to ask you some questions, and I need honest answers. Understood? Am I under arrest? No, but your cooperation would be appreciated. He pulled out a photograph, faded, military grade, showing a woman in combat fatigue standing in front of a field hospital. The woman's face was partially obscured by dust and harsh lighting, but recognizable as her. Do you know this person? Kimball asked. Meredith looked at the photo, then at Webb, who was watching her with barely concealed intensity. She looked at Lindholm, whose expression gave away nothing, at the legal representative who had a pen poised over a notepad. I want to know why DOD is in my hospital asking about my staff, Lindholm said before Meredith could answer. That's classified. Then this meeting is over. Kimball's jaw tightened. Dr. Lindholm, I appreciate your position, but this is a matter of national security. I don't care if it's a matter of planetary security. That's my nurse. And unless you're charging her with something, I'm not letting you interrogate her without context. Silence stretched taut. Finally, Kimball closed the folder. Fine. 3 days ago, a former military asset was potentially identified at this hospital. We're following up on that identification. Asset? Webb leaned forward. What kind of asset? The kind that doesn't exist on paper anymore. Meredith felt the walls closing in. This was it. The moment she'd been running from for 2 years, her old life catching up, dragging her back into a world she'd tried to leave behind. The photo, Kimball continued, shows a military medical officer who served in multiple combat zones before disappearing from service. No discharge papers, no forwarding address. Just gone. His eyes fixed on Meredith. That officer was you, wasn't it? She could lie, should lie. But something in Kimball's expression told her he already knew the answer. He wasn't here to investigate, he was here to confirm. Yes, she said quietly. Webb made a sound like he'd been punched. Lindholm's expression didn't change, but her fingers tightened slightly on her pen. Captain Ava Winters, Kimball said. Combat surgeon, 3 tours, decorated for valor, credited with saving over 200 lives in field conditions. He paused. And then you vanished after the incident in Kandahar. What incident? Webb demanded. Classified. Everything's classified with you people because it needs to be. Kimball's voice hardened. What happened in Kandahar was complicated, politically sensitive, the kind of thing that ruins careers and gets people killed if it becomes public. He looked back at Meredith. You left without authorization, without debriefing, without giving anyone the chance to sort out what really happened. I know what happened, Meredith said. I was there. And now you're working under a false identity in a civilian hospital. My nursing credentials are legitimate. I passed all the required. I'm not questioning your qualifications. I'm questioning your presence. Kimball leaned back. The military has been looking for you for 2 years, not to prosecute, to bring you back. Your skills are needed, especially now. I'm not going back. You don't have a choice. The hell she doesn't. Lindholm's voice cut through the tension like a scalpel. Agent Kimball, unless you're placing her under arrest, she has every right to refuse. And if you are arresting her, I want to see a warrant and a lawyer present. Kimball studied Lindholm for a long moment. Then he pulled out another document. This is a security assessment request. It allows us to evaluate potential security risks posed by former military personnel with access to sensitive information. Meaning what? Meaning Captain Winters, Ms. Cole, worked with classified medical protocols during her service. Intelligence wants to ensure she hasn't compromised that information. That's absurd, Webb said suddenly. Everyone looked at him. He was staring at Meredith with something between anger and awe. You think she's been selling secrets? She's been here 6 weeks working double shifts and saving lives. If she wanted to profit from classified intel, she wouldn't be emptying bedpans for minimum wage. It was possibly the most supportive thing Webb had ever said to her. Meredith almost didn't believe she'd heard it correctly. Kimball's expression didn't soften. Nevertheless, the assessment is mandatory. Captain Winters will need to report to Fort Lewis within 72 hours for debriefing. And if I refuse? Then this becomes a criminal matter rather than an administrative one. The trap closed completely. She could go voluntarily and face whatever consequences the military decided, or she could refuse and get arrested. Either way, her life as Meredith Cole was over. I need time, she said. You have until Monday morning. Kimball stood, gathered his folder, and left without another word. The legal representative followed. The door closed, leaving Meredith alone with Lindholm and Webb. Nobody spoke for a long moment. Then Webb exhaled slowly. Holy shit. That about covers it, Lindholm agreed. She looked at Meredith. How much of what he said was true? All of it. The incident in Kandahar. What happened? Meredith's hands clenched involuntarily. The memories she'd worked so hard to bury clawed their way to the surface, sand and blood, screaming, the impossible choice that had destroyed her. I can't talk about it. Can't or won't. Both. Lindholm studied her for another moment, then nodded slowly. All right, but you need to understand something. If you're dealing with the DoD, you're going to need allies, people who can vouch for you, people who can testify to your character and your competence. Why would you do that? Because in the last 3 days, you've proven yourself to be one of the best trauma nurses I've ever seen. And because Webb was right, If you wanted to profit from classified knowledge, you wouldn't be here. She stood. Take the rest of the day off. Think about what you want to do. But know that whatever you decide, you're not alone in this. She left. Webb remained seated, still staring at Meredith like she'd just materialized from thin air. Combat surgeon, he said finally. 3 tours. 200 lives saved. It doesn't matter. Doesn't... He laughed, but it sounded hollow. I've been treating you like you're barely qualified to take blood pressure, and the whole time you've had more field experience than half my surgical team combined. I didn't want anyone to know. Why the hell not? Because being Captain Winters meant being the woman who'd failed. The woman who'd watched soldiers die because she'd had to choose which ones to save and which ones to let go. The woman who'd carried that weight until it crushed her completely. But she couldn't say that to Marcus Webb. It's complicated, she said instead. No shit. He ran a hand through his hair. Look, I've been an asshole to you, a complete asshole, and now I find out you've been, what, hiding, running? Surviving. The word hung in the air between them. Webb's expression shifted into something she'd never seen from him before, something almost like respect. The DOD wants you back. Are you going to go? I don't know. What happened in Kandahar? I can't... Yeah, I got that part, classified, but whatever it was, it broke you bad enough that you walked away from your entire career. He leaned forward. So here's what I'm wondering. If you go back, are they going to fix what broke? Or are they just going to use you up until there's nothing left? It was the most insightful thing he'd ever said to her, and she didn't have an answer. Meredith left the hospital in a daze, drove home through Portland's gray afternoon rain, and sat in her apartment staring at nothing. The walls felt closer than usual, the silence louder. Her phone buzzed. A text from a blocked number. You have 72 hours. Don't make this difficult. Kimball. She threw the phone onto her couch and put her head in her hands. 2 years. 2 years of carefully constructed invisibility, and it had all come apart in 3 days. Because of one man from her past, because of one federal agent with the right clearances, because she'd been stupid enough to think she could outrun who she used to be. The knock on her door made her jump. She opened it to find Marcus Webb standing in the hallway, still in his hospital scrubs, holding a 6-pack of beer. What are you doing here? I looked up your address in the system. He held up the beer. And I figured you could use this more than I could. That's a HIPAA violation. Sue me. Despite everything, she almost smiled. She stepped back and let him in. They sat at her small kitchen table, the beer between them, rain pattering against the windows. For several minutes, neither of them spoke. Webb just looked around her apartment, at the bare walls, the minimal furniture, the complete absence of personal photos or decorations, a place where someone lived but didn't belong. You really committed to the disappearing act, he said finally. It seemed important at the time. And now? She opened a beer, took a long drink. Now, I don't know what's important anymore. Webb studied her. The mass casualty incident. The way you worked. That wasn't civilian training. That was someone who'd operated in combat conditions. Someone who'd dealt with triage situations where people die no matter what you do. Is there a question in there? How many did you lose? The words hit like a physical blow. Because that was the question, wasn't it? Not how many she'd saved, how many she'd lost. Too many, she said quietly. In Kandahar? She didn't answer, couldn't answer, because Kandahar was where the math had finally broken her, where she'd been forced to choose 3 soldiers with severe injuries versus 1 soldier with catastrophic trauma. Save the 3 and let the 1 die, or gamble everything on the 1 and risk losing them all. She'd chosen the 3. The 1 had died cursing her name, and it turned out the 1 had been the nephew of a senator, the one whose death sparked investigations and political inquiries and questions about whether Captain Ava Winters had made the right call, whether her judgment had been sound, whether she'd let personal bias affect her triage decisions. They'd cleared her officially, called it an impossible situation, thanked her for her service, but she'd heard what they really thought in the hallways, in the whispered conversations that stopped when she entered the room, in the way her commanding officers had looked at her after the inquiry ended, so she'd walked away, changed her name, buried Captain Winters, and became someone smaller, quieter, less remarkable. Someone who couldn't fail because no one expected anything from her. Webb seemed to read something in her silence. The DoD wants you back because you're good, the best, probably, but you don't want to go back because being the best means carrying all the weight again, all the choices, all the consequences. You don't know what you're talking about, don't I? He took a drink of his beer. I'm the best cardiothoracic surgeon in this hospital, maybe the best in the state. You know what that means? It means every high-risk cardiac case lands on my table, every impossible repair, every patient everyone else has given up on. And when they die, because sometimes they do, no matter how good you are, it's my failure, my weight to carry. That's not the same, isn't it? He leaned forward. I've been a complete bastard to you because you threatened that. You showed up with better instincts, better judgment, better crisis response than most of my residents. And I couldn't handle it because I'm supposed to be the best. I'm supposed to be the one everyone looks to. He paused. But you? You were already the best, and it broke you anyway. Meredith felt something crack inside her chest. Because he was right. God help her. Marcus Webb was absolutely right. I can't go back, she whispered. Then don't. Kimball said you have 72 hours. He didn't say what you have to do with them. Webb finished his beer. Look, I'm not going to pretend I understand military law or DoD politics, but I know medicine and I know trauma, and I know that forcing someone who's already broken back into the thing that broke them is how you get dead soldiers and failed missions. What are you suggesting? I'm suggesting you fight, not by running, that hasn't worked, but by standing your ground, by being Captain Ava Winters again, just long enough to remind them why they can't afford to push you around. I'm not her anymore. Bullshit. His voice hardened. I saw you during that mass casualty. I saw you move, saw you think, saw you save lives that any other nurse would have lost. Captain Winters isn't dead. She's just been hiding inside Meredith Cole. And maybe it's time she came out. Before Meredith could respond, her phone rang. Not a blocked number this time. The hospital. She answered. Hello? Angela's voice was tight with panic. Meredith, we need you back here right now. What happened? There's been a chemical exposure at a manufacturing plant downtown. We're getting reports of 40 to 50 workers affected, respiratory distress, burns, possible toxic inhalation. It's going to be bigger than the highway incident. I'm off duty. I know, but Lindholm specifically asked for you. She said, Angela's voice dropped. She said we need Captain Winters, not Nurse Cole, whatever that means. Meredith closed her eyes. The trap was closing from every direction now. The DoD demanding she return, her past exposed, and now a mass casualty incident that would require everything she'd tried to leave behind. I'll be there in 20 minutes, she said. She hung up and found Webb already standing. I'll drive, he said. You've been drinking. They drove through Portland's evening traffic in tense silence. Emergency lights from approaching ambulances painting the streets in red and blue. By the time they reached Riverside General, the parking lot was already chaos. News vans, emergency vehicles, staff pouring in from every direction. Meredith and Webb entered through the ER bay doors and found themselves in the middle of organized pandemonium. Dr. Lindholm was at the command center, coordinating responses. Nurses and physicians scrambled to prep trauma bays. The first ambulances were already unloading patients. Lindholm saw Meredith and her expression hardened with determination. Cole? Winters. Whoever you are right now, I need you in Bay 4. Chemical burns and respiratory trauma. The patients are contaminated. You'll need full hazmat protocols. Meredith nodded and moved toward the equipment lockers, but Lindholm caught her arm. I meant what I said earlier. You're not alone in this. Whatever happens with the DoD, we've got your back. She paused. But right now I need the soldier, not the hiding nurse. Understood? Something inside Meredith straightened. Some old posture, some half-forgotten bearing that had carried her through 3 combat tours. Understood, she said. She suited up in protective gear, hazmat suit, respirator, double gloves. Watched herself in the reflection of the equipment locker and barely recognized the figure staring back. Not Meredith Cole. Not quite Captain Winters. Something in between. The first wave of patients arrived covered in chemical residue, their skin blistered, their breathing labored. Meredith moved into the chaos with the same efficiency she'd shown during the highway incident, but this time something was different. This time she wasn't hiding behind protocol and deference. This time she gave orders. Get me 3 liters of saline for decontamination. Use the warm water, not cold. That chemical reacts exothermically. A resident stared at her. How do you know, because I've treated exposure before. Move. He moved. Patient after patient after patient. Burns. Inhalation injuries. Systemic toxicity. Each one requiring split-second decisions and precise interventions. Meredith didn't hesitate, didn't second-guess, just acted with the kind of decisive competence that came from years of battlefield medicine. Webb worked beside her, and for the first time since she'd met him, they operated as equals. He deferred to her chemical exposure knowledge. She deferred to his surgical expertise. They moved around each other with the kind of synchronized efficiency that came from mutual respect. 4 hours in, they'd stabilized most of the critical cases. Then the doors burst open and paramedics wheeled in a patient who made Meredith's blood run cold. Male, mid-30s, military bearing visible despite his injuries, catastrophic chemical burns covering 60% of his body, respiratory failure, going into shock, and pinned to his chest, somehow still intact, was a military ID badge. Fort Lewis. DoD Medical Research Division, the same facility Kimball wanted her to report to. The patient's eyes opened briefly, focused on Meredith through her hazmat visor, and widened with recognition. Captain Winters? He rasped. Thank God. They said you were... He started coughing violently, blood flecking his lips. Every head in the trauma bay turned toward her, and standing in the doorway, watching everything with cold calculation, was Agent Kimball. Meredith's training overrode everything else. The shocked stares, Kimball's presence, the exposure of her identity spreading through the trauma bay like wildfire. None of it mattered because a man was dying in front of her. Get him on high-flow oxygen, 15 liters. Start 2 large-bore IVs, push fluids wide open. Her voice came out steady, commanding, nothing like the quiet nurse who'd been hiding for 2 years. I need burn assessment now. The patient grabbed her wrist with what little strength he had left. Captain, the protocol. They're using the protocol. Save your energy. Don't talk. You have to know. More coughing, more blood. His grip weakened. Webb appeared at her shoulder, already gloved and assessing the burns. This is bad. We're looking at full-thickness burns over most of his torso. If we don't get him debrided and grafted in the next few hours, I know. Meredith's hands moved with practiced efficiency, cutting away clothing that had melted into skin, exposing the horrific damage beneath. Chemical burns were different from thermal burns. They kept destroying tissue long after exposure ended. We need to neutralize the chemical first. What was the exposure agent? A paramedic consulted his notes. Plant supervisor said it was an experimental decontaminant, some kind of military-grade compound. Military-grade. Of course it was. Meredith looked up and found Kimball still watching from the doorway. Their eyes met across the chaos of the trauma bay, and she saw something calculating in his expression. This wasn't coincidence. This patient, this exposure, this timing, none of it was random. Get me the MS-DS sheet for that compound, she called out. And someone get Agent Kimball out of my trauma bay before I have security remove him. Kimball didn't move. That patient is a federal asset working on classified research. I need to be present during, he's my patient right now, and you're contaminating a sterile environment. Meredith's voice dropped to something cold and absolute. Either leave voluntarily, or I'll have you dragged out. Your choice. For a moment, Kimball looked like he might argue. Then he stepped back into the hallway, but his presence remained like a shadow just beyond the door. The patient's vitals were crashing, blood pressure dropping despite the fluids, oxygen saturation falling even with supplemental oxygen. His breathing turned ragged, desperate. He's going into respiratory failure, Webb said. We need to intubate. No. Meredith's hands were already moving, palpating the patient's neck, feeling for the landmarks she needed. His airways compromised by chemical burns. If we try standard intubation, we'll cause more damage. We need a surgical airway. A cricothyrotomy? Here. You have a better idea? Webb's jaw tightened, but he grabbed the necessary equipment without further argument. Do it! Meredith positioned herself at the head of the bed, feeling for the cricothyroid membrane between the thyroid and cricoid cartilage. Her fingers found the depression, marked the spot. One chance. If she missed, the patient died. The scalpel felt familiar in her hand, too familiar. She made the horizontal incision, quick, controlled, exactly 1.5 centimeters. Blood welled up, but not as much as it could have been. She inserted the tracheal hook, pulled up on the cricoid cartilage, and slid the tracheostomy tube into the opening. Air rushed in. The patient's oxygen saturation began climbing. 78, 82, 87. The trauma bay had gone completely silent. Every nurse, every resident, every staff member was staring at her with the same expression Mitchell had worn 3 days ago. Recognition, shock, the sudden understanding that they'd been working alongside someone whose skills operated on an entirely different level. "Someone want to tell me where a trauma nurse learned to perform a field crick in under 30 seconds? A resident whispered. Angela, standing near the supply cart, spoke up. She didn't learn it as a trauma nurse. All eyes turned to Meredith. She didn't acknowledge them, just focused on her patient, on the burns that still needed treatment, on the life she was fighting to save. "I need silver sulfadiazine cream, sterile gauze, and a burn unit consultation. Move." They moved. The next 2 hours blurred into a desperate fight against chemistry and time. The chemical compound, something called XK7, according to the MSDS sheet that finally arrived, was a decontamination agent designed to neutralize biological weapons. It was also apparently catastrophically corrosive to human tissue if exposure protocols weren't followed precisely. Meredith had treated XK7 exposure before. Once. In a classified medical tent outside Kandahar, where she'd been brought in to consult on a soldier who'd been accidentally sprayed during a weapons facility raid. She'd saved that soldier, but barely. The protocols weren't in any civilian medical textbook. They existed only in classified military medical databases, which meant the DoD knew she'd be one of the only people in Portland who could save this patient. The calculation was obvious now. They'd let the chemical plant incident happen, or at least they hadn't prevented it. Had put one of their own researchers in harm's way. All to force her hand, all to prove she was still the weapon they needed. The realization made her hands shake with fury, but she channeled it into precision. Every movement deliberate. Every decision calculated. She treated the patient the way she'd treated dozens of soldiers in combat, with ruthless efficiency and absolute focus. By the time they'd stabilized him enough for transfer to the burn unit, Meredith's hazmat suit was soaked with sweat, and her muscles ached from sustained tension. She stripped off the protective gear in the decontamination area, her hands finally starting to tremble now that the immediate crisis had passed. Webb appeared beside her, also shedding his hazmat equipment. That was the most impressive trauma response I've ever witnessed, and I trained at Johns Hopkins. It was just standard. Don't. His voice cut through her deflection. Don't minimize what you just did. That patient should be dead. Hell, most surgeons would have lost him in the first 20 minutes, but you knew exactly what he needed before his monitor even started alarming. I've had practice. In war zones. It wasn't a question. Webb pulled off his gloves and looked at her directly. How many soldiers did you save like that? I stopped counting. And how many did you lose? The question hit like a blade between her ribs, because that was the number she'd never stopped counting. The faces that visited her in nightmares, the names she'd memorized from dog tags and casualty reports. Enough, she said quietly. They emerged from decontamination to find half the hospital staff waiting in the hallway. News had spread. Not just about the chemical exposure, not just about the dramatic save, but about who Meredith really was. She could see it in their faces, the shock, the awe, the recalibration of every interaction they'd had with her over the past 6 weeks. Dr. Lindholm pushed through the crowd. My office. Now. You too, Webb. They followed her down the administrative corridor for the second time that day. But this time, when they entered the office, they found it wasn't just Lindholm waiting. Agent Kimball sat in one of the chairs, his expression unreadable. And beside him stood a woman in an army uniform, a colonel based on her insignia, with steel gray hair and eyes that had seen too many wars. Captain Winters. The colonel's voice carried the weight of absolute authority. Or do you prefer Cole these days? Meredith said nothing. I'm Colonel Rebecca Strassman, Army Medical Command. I was your CO in Kandahar, and I've been looking for you for 2 years. The room seemed to compress. Meredith had served under Strassman during her 3rd tour, had respected her, even admired her. But after Kandahar, after the incident and the inquiry and the political fallout, Strassman had been one of the officers who'd looked at her differently, who'd said all the right things publicly while privately recommending she be reassigned away from combat zones. With all due respect, Colonel, I left that life behind. You left without permission, without proper discharge, without giving us a chance to explain what really happened that night. Strassman leaned forward. The inquiry cleared you, Ava. Completely. The senator's nephew died because of enemy action, not because of your decisions. We found proof of intelligence leaks, of deliberate targeting. You made the right call under impossible circumstances. Doesn't change the outcome. No. But it changes the responsibility. Strassman pulled out a folder, identical to the one Kimball had shown earlier. You've been carrying blame that was never yours to carry, and in the process, you've deprived the military of one of its most talented combat surgeons. I'm not going back. You don't have a choice. Kimball spoke up for the first time. That patient you just saved? He's part of a classified medical research program developing protocols for biological and chemical warfare scenarios. The same program you consulted on during your service. He recognized you immediately, which means your cover is completely blown. I don't have a cover. I have a legitimate nursing license and a legal name change. Which won't mean anything when the media gets hold of this story. Kimball's voice stayed flat, factual. Former military surgeon working under false identity at civilian hospital. High-profile mass casualty incidents. Federal agents investigating. The press will have a field day. Your hospital will be sued into oblivion, and you'll be facing charges for identity fraud and unauthorized use of classified medical protocols. It was a threat wrapped in bureaucratic language. Comply or be destroyed. Come back or lose everything. Lindholm stood abruptly. Get out of my office. Strassman looked surprised. Excuse me. You heard me. Get out, both of you. Lindholm's voice shook with barely controlled fury. You come into my hospital, threaten my staff, and expect me to just hand over one of the best medical professionals I've ever worked with? Not a chance. Dr. Lindholm, you're interfering with a federal... I don't care if I'm interfering with the Second Coming. That woman just saved a life you people deliberately endangered to manipulate her. You want to talk about legal liability? Let's talk about how the DoD is going to explain why they allowed a chemical weapons exposure in a civilian area just to leverage a former soldier. Silence fell like a hammer. Kimball's expression darkened. That's a serious accusation. Is it wrong? He didn't answer, which was answer enough. Strassman stood, her face carefully neutral. Captain Winters, you have 72 hours to report to Fort Lewis. If you don't, we'll pursue criminal charges. That's not a threat. That's a statement of legal fact. She paused at the door. But I hope you'll come voluntarily. Not because we're forcing you, because you're needed, because soldiers are dying from injuries you'd know how to treat, because the protocols you developed are saving lives every day, and we need you to train others. They left. The office felt suffocating after they'd gone. Meredith sat down heavily, her legs finally giving out. Webb remained standing, his arms crossed, his expression dark. They're going to destroy you if you don't comply, he said. I know. So what are you going to do? Before Meredith could answer, her phone buzzed. A text from an unknown number. Mass casualty incoming. Military transport crash on Highway 26. Multiple critical injuries. ETA 8 minutes. Dispatch. She showed the screen to Lindholm. Another one? Webb's voice carried disbelief. 3 mass casualty incidents in 4 days? That's not coincidence. No, Meredith said quietly. It's not. She stood and walked to the window, looking out over the Portland skyline. Rain streaked the glass, distorting the lights into abstract patterns. Somewhere out there, soldiers were dying, civilians were dying, people who needed skills she'd spent years developing and 2 years trying to forget. They're going to keep doing this, she said, creating crises, engineering situations where I'm forced to reveal myself, where I have to choose between hiding and saving lives. That's monstrous, Lindholm said. That's war. Meredith turned back to face them. They want Captain Winters back. and they're willing to sacrifice anyone necessary to make that happen. Webb's expression shifted into something calculating. Then maybe it's time Captain Winters reminded them why she walked away in the first place. What are you suggesting? I'm suggesting you stop playing defense. Stop letting them control the narrative. He leaned forward. You want out of the military? Fine. But you don't get out by hiding. You get out by being so publicly valuable, so visibly essential, that they can't afford to prosecute you without looking like the villains they are. That's insane. Is it? Look at what happened tonight. You saved a federal asset using classified protocols in full view of hospital staff. If they charge you now, they have to explain why they let that asset get injured in the first place. They have to admit to manipulating civilian emergency situations for political leverage. Lindholm was nodding slowly. He's right. The DoD has power, but so does public opinion. If we can document what they're doing, You can't fight the Department of Defense, Meredith interrupted. They have unlimited resources, unlimited authority. I'm just one person. You're Captain Ava Winters, Webb said, the woman who saved 200 soldiers, who developed protocols still being used in combat medicine, who can perform a surgical airway in 30 seconds under crisis conditions. He paused. And you're not alone anymore. The words hung in the air, fragile and impossible. Meredith wanted to believe them, wanted to believe she could stand up to the machine that had broken her. But she'd been through this before. She'd tried to fight after Kandahar, tried to defend her decisions, her judgment, her choices. And the system had ground her down until there was nothing left but guilt and exhaustion. The transport is 6 minutes out, Lindholm said, checking her phone. Whatever you decide about the DoD, right now there are casualties incoming who need treatment. Meredith closed her eyes, took a breath, made a choice. I'll treat them, but I'm doing it as Captain Winters, not Meredith Cole. She opened her eyes. No more hiding, no more pretending to be less than I am. If the DoD wants me back, they're going to have to drag me, and I'm going to make sure everyone's watching when they try. Webb smiled, actually smiled. Now we're talking. They headed to the ER together, Meredith still in her scrubs, no longer trying to blend into the background. Staff parted as she walked past, their expressions a mixture of respect and uncertainty. She'd gone from invisible to infamous in the span of a single shift. The ambulances arrived with sirens screaming. The first patient was a young soldier, couldn't have been more than 23, with a severe head injury from the transport crash. His skull was fractured, brain swelling visible even without imaging. He was seizing when they wheeled him in, his body convulsing violently. Get me propofol and prepare for intubation, Meredith ordered. And call neurosurgery. He's going to need an emergency craniotomy. But even as she worked to stabilize him, 3 more crash victims arrived. Then 4 more. Then 6. The ER filled with military casualties, each one critical, each one demanding immediate intervention. And standing at the entrance, coordinating the chaos with military precision, was Colonel Strassman. She'd orchestrated this. Another pressure point, another manufactured crisis designed to prove that Captain Winters was still needed. Meredith felt rage building in her chest, but she channeled it into her work. Every soldier she saved was proof that she was still here, still capable, still the weapon the DoD wanted to reclaim. But every soldier she saved was also proof that she'd never really stopped being Captain Winters. She'd just been pretending. 2 hours into the chaos, Meredith was working on a soldier with catastrophic internal bleeding when she heard a familiar voice behind her. Captain. She turned to find Staff Sergeant Mitchell standing in the trauma bay entrance, now dressed in full military uniform. His expression was grave. What are you doing here? She asked. I'm part of Colonel Strassman's team. I was assigned to locate you. He stepped closer, lowering his voice. Ghost, I need to tell you something. The crash tonight, it wasn't an accident. Her hand stilled on the patient's chest. What? The transport was carrying soldiers from the Fort Lewis Medical Research Program. The same program your patient from the chemical exposure worked for. Mitchell's voice dropped even further. Someone sabotaged the vehicle. Made it look like mechanical failure. But I saw the brake lines before they hauled the wreck away. They were cut. Ice flooded Meredith's veins. Who ordered it? I don't know, but Ghost, someone in the DoD wants you back bad enough to kill for it. Bad enough to sacrifice soldiers, their own people, just to create situations where you have to step up. The patient in front of her started crashing. Meredith's training kicked in immediately, but her mind was racing. If Mitchell was right, if someone was deliberately causing casualties to manipulate her, then everyone in this ER was here because of her. Every injury, every death, all her fault. "I can't do this," she whispered, still working mechanically on the patient. "I can't be responsible for—" "You're not responsible. The people doing this are." Mitchell's hand gripped her shoulder. "But Ghost, you need to figure out who's giving these orders, because they're not going to stop." Before she could respond, Webb called from across the bay. "Winters, I need you here. This patient's bleeding from somewhere I can't see." She moved to his side, finding a soldier with a penetrating abdominal injury. Blood pooled beneath him. Far too much blood. Webb had his hands in the wound, trying to control the hemorrhage, but it wasn't working. "The bleeding's not from the entry wound," Meredith assessed quickly. "It's tracking retroperitoneal. You're feeling the wrong vessels." "Then where—" She didn't wait for him to finish, just moved his hands aside and reached into the wound, with the kind of certainty that came from having done this hundreds of times. Her fingers found the damaged vessel, an iliac artery torn by shrapnel, and clamped it with steady pressure. "Get me a vascular clamp. And someone call the OR. This needs surgical repair now." The soldier's vitals stabilized, barely, but stable enough to buy time. Webb was staring at her hands, still inside the patient's abdomen, holding pressure on an artery she'd located by touch alone. "How did you know where to find that?" "Experience." "That's not experience. That's something else entirely." He was right. It was muscle memory, combat memory, the kind of knowledge that got written into your bones after seeing the same injury pattern over and over in field conditions, the kind of knowledge that proved she'd never really left the war. They worked through the night, patient after patient, each one demanding everything she had. By 4 a.m., most of the casualties had been stabilized or sent to surgery. The ER finally began to quiet. Meredith stood at the sink, scrubbing blood from her hands, when Colonel Strassman appeared beside her. "Impressive work tonight, Captain." "Don't." Meredith's voice came out flat. "Don't congratulate me for cleaning up a mess you created." "I didn't create anything. I'm just responding to situations as they develop." Mitchell says the transport was sabotaged. Strassman's expression didn't change. "Staff Sergeant Mitchell has an overactive imagination." "Does he? Or does someone in your command structure think sacrificing soldiers is an acceptable way to manipulate former personnel?" "That's a serious accusation." "You used the exact same words Kimball did." Meredith turned off the water, dried her hands. "Which tells me you're both reading from the same script. Which tells me this goes higher than either of you." Strassman studied her for a long moment. Then she pulled out her phone and showed Meredith a photograph. A military hospital. Rows of beds filled with wounded soldiers, and standing among them, treating injuries with focused intensity, was a woman Meredith recognized immediately. Captain Ava Winters, 2 years younger, still believing she could save everyone. "This is what you were," Strassman said quietly. "This is what the military needs you to be again. Not because we want to manipulate you, not because we want to control you, but because soldiers are dying from injuries you'd know how to treat. Because the protocols you developed are the difference between life and death in combat zones. Then publish the protocols, train other surgeons. You don't need me. We've tried. But combat medicine isn't just about knowledge. It's about instinct, about being able to make life or death decisions in seconds without hesitation. You have that gift, Ava, and we're asking you to use it. By threatening me, by destroying my civilian life, by orchestrating crises that prove I can't escape who I was, by showing you the truth." Strassman pocketed her phone. "You never really left the war, Captain. You just stopped fighting it, and now soldiers are paying the price for your absence." She walked away, leaving Meredith alone with the sink and the harsh fluorescent lighting and the weight of 2 years of denial crashing down on her shoulders. Because Strassman was right. Every protocol Meredith had developed, every technique she'd perfected, every lesson she'd learned in blood and sand, all of it was still saving lives somewhere, just not by her hands. And if she could do more, save more, teach more, wasn't she obligated to try? But at what cost? She'd left the military because it had broken her. Because the weight of deciding who lived and who died had crushed something essential inside her. If she went back, if she let Captain Winters fully resurface, would there be anything of Meredith left? She She was still wrestling with the question when Angela found her an hour later. "Hey, you should see this." Angela led her to the break room where several staff members had gathered around a television. The morning news was on, and the headline made Meredith's blood run cold. Heroic nurse revealed as decorated combat surgeon. The screen showed footage from the ER. Someone had recorded video during the chemical exposure. It showed Meredith performing the cricothyrotomy, her hands steady, her movements precise. Then it cut to interview clips with hospital staff talking about the multiple mass casualty incidents, about the mysterious nurse who'd saved dozens of lives. Sources confirmed that Meredith Cole is actually Captain Ava Winters, a former Army combat surgeon who disappeared from service 2 years ago, the news anchor said. Military officials have not commented on Captain Winters' current status, but her impressive performance during last night's crises has raised questions about why such a talented medical professional was working under an assumed identity. The segment ended with a call for interviews, for more information, for the full story behind the mysterious military hero hiding in plain sight. Meredith's carefully constructed invisibility was completely, irrevocably shattered. Her phone exploded with notifications, news requests, interview offers, messages from former colleagues, and one text from Kimball that made her hands shake. "You wanted everyone watching, now they are. Fort Lewis. Monday morning. Or we release the full details of Kandahar to the press. Your choice. Kimball." It was the final trap, the ultimate pressure point. Go back to the military voluntarily, or watch them destroy what was left of her reputation by releasing a twisted version of the incident that had broken her. Quote her. Webb appeared at her shoulder, reading the message over her arm. "They're going to spin Kandahar as negligence. Make you look like you panicked, made bad calls, got a soldier killed through incompetence." "I know." "So what are you going to do?" Meredith looked around the break room at the faces watching her, colleagues who'd worked beside her for weeks without knowing who she really was. Staff who'd seen her save lives tonight with skills they'd never imagined. People who were looking at her now not with contempt or dismissal, but with respect, with awe. For the first time in 2 years, she wasn't invisible. And maybe Webb was right. Maybe the only way out was through. Not by hiding, but by standing up. Not by letting the DOD control the narrative, but by telling her own story first. "I'm going to do something stupid," she said quietly. "How stupid are we talking?" She pulled out her phone and started typing. Not a response to Kimball. A message to one of the news outlets that had been requesting interviews. "I'll tell you about Kandahar. All of it. On camera. Tonight. Ava Winters." Webb read the message and his eyes widened. "You're going to go public before they can? That's insane. Yeah, but it's the only move they won't expect." She hit send before she could second-guess herself. "If I tell the truth first, they can't weaponize it. If I expose what really happened, they lose their leverage. They'll court-martial you. Maybe. But they'll have to do it publicly, and the whole world will be watching." The response came back within seconds. An address, a time. Tonight at 8 p.m. Meredith had 12 hours to prepare for the interview that would either save her or destroy her completely. She spent the day at home trying to organize her thoughts, trying to figure out how to explain 2 years of running without sounding like a coward. Trying to find words for the weight she'd been carrying since that night in Kandahar. Around noon, there was a knock at her door. She opened it to find Marcus Webb standing there with coffee and a determined expression. "You're not doing this alone," he said simply. "Webb, I'm going with you to the interview. As your colleague. As someone who can testify to your skills, your judgment, your character." He handed her the coffee. "And I called Lindholm. She's coming too. So is Angela. So are about 15 other staff members who watched you work last night." "Why would you do that?" "Because you stood up for yourself. Finally. And people like that deserve backup." He paused. "Also, I've spent 2 months treating you like you were barely competent, and I'd like a chance to publicly admit I was completely wrong about you." Despite everything, Meredith almost smiled. "You don't have to what?" "Yes, I do. We all do. You've been fighting alone for 2 years. Time to stop." By 7 p.m., they'd assembled at the television studio, a small crowd of Riverside General staff, all wearing their hospital credentials, all ready to speak on camera about the nurse who'd turned out to be something extraordinary. The interviewer was a woman named Rachel Kim, a local journalist known for hard-hitting investigative pieces. She sat across from Meredith in the studio, cameras rolling, and got straight to the point. Captain Winters, let's start with Kandahar. What really happened that night? Meredith took a breath. 2 years of silence, 2 years of carrying the story alone, 2 years of letting the military's version fill the void. Time to break the silence. We were conducting a medical supply transfer to a forward operating base when we came under attack, she began, her voice steady despite the cameras. 3 soldiers were critically wounded in the initial blast. Multiple shrapnel injuries, severe bleeding. Standard triage protocol said I should focus on the 3 soldiers who had the best chance of survival. But you didn't? No, because there was a 4th casualty. A soldier with catastrophic chest and abdominal trauma. His chances of survival were maybe 10%, even with immediate intervention. The other 3 had 50-50 odds with standard treatment. Rachel leaned forward. So what did you do? I made the math work. I stabilized the 3 first, stopped their bleeding, secured their airways, got them to a point where they could survive the transport to the main hospital. It took 12 minutes. Then I turned to the 4th soldier. The senator's nephew. I didn't know who he was. I just knew he was dying. Meredith's hands clenched. I worked on him for 43 minutes. I used every technique I knew, every protocol I'd developed, but the damage was too severe. He died cursing my name, saying I'd abandoned him, saying I'd chosen the others over him. Had you? Yes. The word came out hard. I'd made a triage decision. 3 lives with decent survival odds versus 1 life with terrible odds. That's not abandonment. That's mathematics. That's battlefield medicine. But the inquiry cleared me of wrongdoing, officially. Meredith's voice hardened. Unofficially, I was told that my judgment had been called into question, that my decisions would be scrutinized going forward, that maybe I'd be better suited to a teaching role away from active combat zones. Rachel consulted her notes. And then you discovered the attack had been based on leaked intelligence. Our position was compromised by an informant. The insurgents knew exactly where we'd be and when. They targeted the medical convoy specifically. The soldier who died, he didn't die because of my triage decisions. He died because someone betrayed us. Did the military acknowledge this? Eventually, after I'd already walked away. The interview continued for another 30 minutes. Meredith laid out everything. The political pressure after the senator's nephew's death, the subtle professional retaliation, the way her career had been quietly strangled, the decision to disappear rather than fight a battle she couldn't win. Then Webb spoke, describing what he'd witnessed during the mass casualty incidents. Lindholm testified to Meredith's performance reviews and skill assessments. Angela talked about the patient who would have died without Meredith's intervention. By the end, the narrative had shifted completely. Not a nurse hiding from failure. A combat surgeon who'd been driven out by politics and bureaucracy despite doing everything right. The interview ended. The cameras stopped rolling. Rachel Kim stood and shook Meredith's hand. This airs in 2 hours. Once it does, the DoD is going to lose their minds. I know. Are you ready for that? Meredith thought about Kimball's threats, about Strassman's pressure, about 2 years of running and hiding and trying to be invisible. No, she said honestly. But I'm done running. They left the studio and returned to Meredith's apartment to watch the broadcast. The room was crowded. Webb, Lindholm, Angela, and several other Riverside staff who'd insisted on being there when the story went public. The segment aired at 9 p.m. Within minutes, Meredith's phone started ringing. News outlets, former military colleagues, advocacy groups for veterans. The story was spreading like wildfire across social media. Then, at 9:43 p.m., her phone rang with a number she recognized. Fort Lewis, Colonel Strassman's office. She answered on speakerphone. Captain Winters. Captain? Strassman's voice was tight. What the hell did you just do? I told the truth. The whole truth. Not the sanitized version you wanted me to keep quiet about. You violated about 15 different... I violated nothing. The inquiry cleared me. The classified status on Kandahar was lifted 6 months ago. I checked. Everything I said tonight is public record. Meredith's voice hardened. You just didn't want anyone paying attention to it. There was a long pause. You've made this very complicated, Strassman finally said. Good. Complicated means you can't just order me back. Complicated means you have to negotiate. Complicated means I'm not a weapon you can pick up and use whenever you need me. Another pause. Then Strassman's voice changed, losing its authoritative edge. Ava, I understand why you left. I do. And I'm sorry we made you feel like you had to disappear, but the offer still stands. We need you. Not as a soldier we can order around, as a consultant, a trainer, someone who can teach others what you know. On my terms? What terms? I stay based in Portland. I work at Riverside General. When you need me, you ask. You don't demand, and you never, ever manufacture crises to manipulate me again. Silence stretched for several seconds. I'll have to clear it with command, Strassman said finally. But Ava, those terms might actually work. They ended the call. Meredith sat back, exhausted, and found Webb watching her with an expression she'd never seen before. Respect. Pure, uncomplicated respect. You just negotiated terms with the United States military, he said. I did. That was... Before he could finish, Meredith's phone rang again. Different number. Unknown. She answered. Hello? Captain Winters. The voice was male, cold, unfamiliar. This is General Harrison Blackwell, Army Medical Command. Colonel Strassman reports to me. Meredith's stomach dropped. This was the final boss, the person at the top of the chain who'd been orchestrating everything. General, I watched your interview. Very illuminating. He paused. You've backed us into a corner, Captain, publicly. Very clever. I just told the truth. The truth has a way of complicating things. His voice carried steel underneath the civility. However, I'm prepared to accept your terms with one modification. What modification? You work for us half a time. 6 months a year at Fort Lewis or wherever we need you. The other 6 months, you're free to practice civilian medicine. Full salary and benefits for both positions. Non-negotiable. It was still a trap. A gentler trap, a more appealing trap, but a trap nonetheless. 6 months meant control, meant deployment possibilities, meant she'd never truly be free of Captain Winters. But it also meant saving lives, training others, using her skills instead of burying them. I need to think about, you have 10 seconds to decide. After that, the offer expires, and we proceed with criminal charges for unauthorized disclosure of classified medical protocols. Your choice, Captain. The room held its breath. Meredith looked at Webb, at Lindholm, at Angela, and the others who'd stood by her tonight. They'd shown her that fighting back was possible, that she didn't have to face the military machine alone. But this decision was hers alone. 5 seconds, Blackwell said. She closed her eyes, saw the faces of soldiers she'd saved, soldiers she'd lost, soldiers who might live if she went back, soldiers who would definitely die if she didn't. I accept, she said quietly. Half-time. My terms otherwise unchanged. Excellent. Report to Fort Lewis tomorrow morning. We'll discuss the details of your first assignment. Tomorrow? Her eyes snapped open. I need time to... Tomorrow, Captain, because your first assignment just arrived at Riverside General's ER. His voice carried grim satisfaction. Multiple casualties from a training exercise gone wrong at Joint Base Lewis McChord. Experimental weapons malfunction, chemical exposure. The kind of injuries that require someone with your very specific skill set. The line went dead. Meredith's phone immediately buzzed with an emergency alert from Riverside Dispatch. Mass casualty alert. Multiple military casualties incoming. Chemical exposure. All available staff report immediately. She looked around the room at the shocked faces of her colleagues. They're not going to stop, Webb said quietly, even after you agreed to their terms. They're going to keep manufacturing situations that prove you're indispensable. I know. So what do we do? Meredith stood, her exhaustion falling away. Because Webb had said we, not you. And that made all the difference. We go save lives, she said, and then we figure out who's really giving these orders. Because Blackwell might command Army Medical, but someone higher up is orchestrating this. Someone with enough power to risk soldiers' lives as leverage. How do you know? because Blackwell told me the assignment just arrived, but I got the alert at the same time he called, which means the casualties were already in transit before I agreed to anything. She grabbed her keys. This wasn't leverage to get me to accept. This is something else. Something worse. They piled into cars and drove back to Riverside General through Portland's late-night streets. The ambulances were already arriving when they reached the ER, sirens screaming, emergency lights painting everything red and blue. Meredith pushed through the doors and found herself face-to-face with Agent Kimball. "Captain Winters," he said, "welcome back to active duty." "I'm not active duty. I'm a civilian consultant. For now." He stepped aside, gesturing toward the trauma bays. "But after tonight, that might change, because the casualties you're about to treat aren't from a training accident." "Then what?" "They're from a raid on a suspected biological weapons facility in Oregon's Coast Range, and one of them is infected with something we've never seen before, something that's already killed 3 people in the last 6 hours." He pulled back a curtain. The soldier on the gurney was covered in pustules, his skin mottled in gray, his breathing ragged. His eyes were open but unfocused, and when he coughed, blood sprayed across the sheets. "Quarantine protocols are in effect," Kimball said. "You're the only person in this hospital with clearance high enough to treat him. The only person with experience dealing with biological agents. The only person. Who can save him?" Meredith finished. "You orchestrated this too, didn't you? Found a real threat and made sure it ended up here. Made sure I'd have no choice but to step up." Kimball's expression stayed flat. "We work with the threats that present themselves, Captain. How we respond is what matters." Meredith looked at the dying soldier, at the pustules spreading across his skin, at the biological weapon slowly killing him from the inside. She'd spent 2 years running from Captain Ava Winters, but Captain Winters wasn't done with her yet. And somewhere in the shadows behind Kimball, behind Blackwell, behind all of this, someone was watching. Someone who'd arranged everything, every crisis, every casualty, every moment of pressure to bring her back. Someone who wanted Captain Winters for something far darker than saving lives. "Suit me up," she said quietly. "Full hazmat protocols. And someone find me everything we know about biological weapons programs in Oregon." She moved toward the quarantine area, and the trauma bay doors closed behind her with a finality that sounded like a prison cell locking. Because she'd just walked willingly back into the cage she'd escaped 2 years ago. And this time, she had no idea how to get out. The quarantine area smelled like disinfectant and fear. Meredith stood outside the sealed chamber, watching through reinforced glass as the infected soldier convulsed on the gurney. His skin had progressed beyond pustules into something worse, necrotic patches spreading across his chest and arms like continents on a diseased map. Webb appeared beside her, already suited in hazmat gear. "I'm coming in with you. You don't have clearance for—" "I don't care about clearance. That's a human being dying in there, and you're going to need surgical backup." His eyes met hers through his visor. "Besides, if this thing is as contagious as Kimball claims, we're probably all exposed already just by being in the same building." He was right. The ER hadn't been properly sealed before the patient arrived. Standard quarantine protocols required advance warning, specialized air handling, negative pressure rooms, none of which they'd had, which meant either Kimball was lying about the contagion risk or he'd deliberately exposed the entire hospital staff to force Meredith's compliance. Both options were horrifying. She suited up and entered the chamber with Webb close behind. The soldier's eyes tracked their movement, conscious but fading. His name tape read Russell, mid-20s. Another kid who'd joined the military thinking he'd serve his country and instead became a pawn in someone else's game. "Russell, can you hear me?" Meredith checked his vitals. Blood pressure dangerously low. Heart rate erratic. Temperature spiking at 104.8. His body was fighting a war it couldn't win. "Hurts," he managed. "Everything hurts." "I know. We're going to help you." She turned to Webb. "I need blood samples, tissue cultures, and a full panel. Whatever this is, it's moving fast. We have maybe 2 hours before organ failure. You've seen this before? Something like it. In Kandahar." The memory surfaced unbidden. A similar case, a soldier exposed to an experimental biological agent during a weapons facility raid. She'd saved him, but barely. The protocols she'd used weren't in any medical database. They'd been improvised, desperate, and classified immediately after the incident. But this strain is different, more aggressive. She worked quickly, collecting samples, documenting symptoms, trying to identify patterns in the infection's progression. Webb assisted with the precision of someone who'd finally recognized he was working with an equal rather than a subordinate. 30 minutes in, Russell started seizing. His back arched, muscles locked in tetanic spasm. Meredith grabbed anticonvulsants, pushed them IV, but the seizure continued. His heart monitor shrieked warnings. "He's coding," Webb said. They worked in synchronized silence, chest compressions, medications, airway management. The kind of desperate choreography that came from too many similar emergencies. Russell's heart restarted after 90 seconds, but his brain activity was flagging. "We're losing him," Webb said quietly. "Not yet." Meredith's mind raced through every biological agent she'd encountered, every treatment protocol she'd developed. There had to be something, some combination of antivirals and immunosuppressants and experimental therapies that could... Her phone buzzed. A message from an unknown number with an attached file. Treatment protocol attached. You have 15 minutes before permanent neurological damage. Don't waste time questioning it. Blackwell. She opened the file. It contained a detailed medical protocol using drugs she'd never heard of in combinations that made no conventional sense. But the pathology matched Russell's symptoms exactly. "Webb, look at this." He scanned the document, his expression darkening. "Half these compounds aren't approved for human use. Some of them don't even exist in civilian databases, which means military research, black budget programs." She looked at Russell's failing vitals. If Blackwell has the treatment protocol, he knew about this biological agent before Russell was exposed, which means someone in the military deliberately infected him. Webb's voice carried cold fury. They used him as a test case, as leverage against you. The implications crashed down like a collapsing building. This wasn't about bringing her back to save lives. This was about proving they could force her to use classified knowledge, could manipulate her into participating in illegal human experimentation, could make her complicit in their crimes. Russell's monitor alarm intensified. 10 minutes left, maybe less. Meredith made the choice. "Get me these medications, everything on this list." "Meredith, I know what this means. I know what I'm agreeing to by using this protocol, but that soldier is dying right now, and I can save him." Her voice hardened. "We'll deal with the consequences after." Webb nodded and left to gather the supplies. Alone with Russell, Meredith placed her hand on his fevered forehead. "I'm not going to let you die for someone else's agenda. Hold on." Webb returned with the medications, pulled from some emergency military supply cache that had apparently been pre-positioned at Riverside. More proof that everything had been orchestrated in advance. They administered the protocol exactly as specified. The drugs were aggressive, borderline toxic, pushing Russell's already compromised system to its absolute limits. For 3 agonizing minutes, his vitals crashed further. His heart rate dropped. His breathing nearly stopped. Then slowly, the infection markers began declining. The pustules stopped spreading. His fever broke. His heart rate stabilized. Russell's eyes opened, clearer than before. "Captain, I'm here." "They told us..." The raid was routine, just inspection. His voice was barely a whisper. But it wasn't. They wanted us exposed. Wanted to see what would happen. "Who told you this?" "Colonel Draven. Said it was vital research. Said we were heroes." Russell's hand found hers, his grip weak. "But we're just lab rats, aren't we?" Before Meredith could answer, the quarantine chamber door opened. Agent Kimball entered, not wearing any protective gear. "The contamination was never real," Meredith said flatly. "The biological agent is real. The contagion risk was exaggerated." Kimball's expression stayed neutral. "But the treatment protocol you just used is very real, and now it's documented, witnessed, proof that Captain Ava Winters has access to classified medical research and is willing to use it." The trap snapped shut completely. By using Blackwell's protocol, she'd proven she still had clearance to classified programs, had demonstrated she'd violate regulations to save a life, had made herself indispensable and compromised simultaneously. "You set this up," Webb said, his voice shaking with rage. "All of it. The exposure, the symptoms, the urgent timeline, just to force her into using illegal treatments. Nothing illegal about saving lives, Doctor. Kimball pulled out a tablet. Captain Winters just signed her own recall orders. The documentation is automatic. Every medication administered, every protocol followed, all of it logged and transmitted to Army Medical Command. She's officially back on active duty as of, he checked the time, 11:47 p.m. That's not how recalls work, Meredith said. It is when the Secretary of Defense signs an emergency medical mobilization order, which was done 3 hours ago. He showed her the tablet. The order was real, official, carrying the weight of the highest civilian authority over the military. Welcome back, Captain. Your next assignment briefing is at 0600 hours, Fort Lewis. Don't be late. He left. Russell looked up at Meredith with eyes that had seen too much, too young. I'm sorry, I didn't know they'd use me like this. It's not your fault. But her hands were shaking now, the adrenaline crash hitting hard. None of this is your fault. She and Webb exited the quarantine chamber and stripped off their hazmat gear in the decontamination area. The hospital around them continued its normal chaos, patients being treated, staff moving between bays, the ordinary machinery of emergency medicine. But everything felt different now, contaminated by the knowledge of how easily it had all been manipulated. Lindholm was waiting outside. What the hell just happened? Kimball's people are saying you're being recalled to active duty, that you're leaving Riverside. I don't know yet. Meredith's exhaustion was bone deep. But they've got me cornered. Every move I make, they've already anticipated. Every choice leads back to them. Then stop playing their game. Lindholm's voice carried steel underneath the concern. You went public with your story. You exposed what happened in Kandahar. Now expose this. Show everyone what they're doing. With what proof? Kimball will deny everything. The recall order is legitimate. The treatment I used was classified but effective. They'll spin it as me fulfilling my duty. What about Russell? He's a witness to the deliberate exposure. A soldier who'll be threatened, transferred, or disappeared if he talks. Meredith leaned against the wall, feeling the weight of 2 years of running finally catching up. They've planned this too well. Every angle covered, every loose end tied up. Webb's expression shifted into something calculating. Unless we find the person giving the orders. Blackwell sent you that protocol, but he's not the one orchestrating all of this. Someone higher up is pulling strings, someone with enough authority to mobilize DoD resources, stage multiple crises, and risk soldiers' lives for leverage. How do we find them? We follow the money. Black budget programs leave traces. Classified research facilities need funding. Someone signing requisitions, approving experimental protocols, authorizing these operations. He pulled out his phone. And I know someone who might be able to help. 10 minutes later, they were in an empty conference room with Webb on a video call with a woman whose background was clearly a federal office building. Marcus, it's midnight. This better be important. It is. Evelyn, this is Captain Ava Winters. Ava, this is my sister, Evelyn Webb. She's a forensic accountant with the Defense Department's Inspector General's office. Evelyn's expression sharpened immediately. The Captain Winters? The one all over the news tonight? That's the one, Webb said. And she's being manipulated by someone in Army Medical Command using black budget programs. We need to find out who's authorizing the funding. That's classified information, Marcus. I could lose my job for they deliberately infected a soldier tonight, used him as a test subject to force Ava into using illegal treatment protocols. People are dying because someone's using medical research as a weapon. Evelyn was silent for a moment. Then her fingers started moving across a keyboard. Give me the details. Everything you know about the programs, the timelines, the personnel involved. They spent the next hour feeding her information. The chemical exposure incident, the transport crash, the biological contamination, the experimental protocols. Evelyn cross-referenced everything against DoD financial records, looking for patterns in classified expenditures. Around 1:30 a.m., she found something. There's a program called MedWar, Medical Warfare Applications Research. It's buried under about 6 layers of classification, but the funding traces back to a Senate Armed Services Committee allocation from 3 years ago. Authorized by... She stopped, her face going pale. Oh no. What? The primary sponsor was Senator Richard Vance, Oregon's senior senator. She looked up from her screen. Who also happens to be the uncle of the soldier who died in Kandahar, the one whose death triggered the inquiry into Captain Winters. The room went absolutely silent. Meredith felt ice flood her veins. Senator Vance, the man whose nephew's death had destroyed her military career. The man who'd pushed for the investigation, who'd demanded answers, who'd made it politically impossible for her to continue serving. He'd been orchestrating everything. He's not just about revenge, Evelyn continued, her voice tight. The Medwar program was expanded significantly after Kandahar. Budget tripled, new facilities commissioned, and the stated goal is to develop rapid response protocols for biological and chemical warfare scenarios using real-world medical data. Human experimentation, Webb said quietly, sanctioned at the highest levels. And Captain Winters' protocols from her combat service became the foundation for the entire program. They've been recreating her trauma scenarios, testing variations, using soldiers as subjects, all to develop weapons-grade medical applications. Meredith's vision tunneled. Her stomach turned. Everything she'd developed to save lives was being weaponized. Every technique she'd perfected under fire was being tested on unwilling subjects. Her legacy wasn't healing, it was harm. "Where's the program based?" she managed to ask. "Primary facility is at Fort Lewis, but there's a secondary research site listed as..." Evelyn checked her notes. "Cascade Biomechanical Research Station, located in the Oregon Coast Range, about 40 miles from Portland. The same location Russell had mentioned, the weapons facility where he'd been exposed." "Can you get us access to the financial records?" Lindholm asked. "Enough to prove what they're doing?" "I can pull them, but it'll trigger alerts. Within an hour, people will know I accessed classified files." "Do it anyway." Meredith's voice came out flat, final. "Pull everything. Every transaction, every authorization, every piece of paper with Vance's name on it. We're done playing defense." Evelyn hesitated only a moment. Then her fingers flew across the keyboard. "Sending you the files now. Marcus, when this blows up, and it will blow up, make sure you're nowhere near me." "Noted." The files arrived. Hundreds of pages of financial records, authorization forms, research protocols. Evidence of systematic human experimentation, unauthorized chemical weapons development, and deliberate exposure of military personnel to biological agents. All approved by Senator Richard Vance through his Armed Services Committee position. All using Captain Ava Winters' combat medical protocols as the foundation. Webb scrolled through the documents, his expression darkening with each page. "This isn't just about bringing you back. Vance wants you destroyed. He wants to prove that your methods, the ones that saved hundreds of soldiers, are actually dangerous. That you're responsible for every casualty in this program." "But why?" His nephew's death was cleared. "Because clearing you meant admitting intelligence failures. Meant acknowledging his nephew died due to compromised security, not medical negligence. And that makes the military look incompetent." Lindholm was reading over Webb's shoulder. Vance couldn't accept that. So he built an entire black budget program to retroactively prove you were wrong. To create evidence that your triage decisions, your protocols, your methods are fundamentally flawed. The implications spread like cracks through ice. If Vance succeeded, every life Meredith had saved would be recontextualized as luck rather than skill. Every protocol she'd developed would be discredited. And every soldier currently being trained on her methods would be taught different techniques that might get them killed. "We have to stop him," Meredith said. "How?" Webb asked. "He's a senator with military oversight authority. We're a civilian doctor and a recalled combat surgeon with questionable legal status. We can't just... We do exactly what we did before. We go public." Meredith pulled out her phone. Rachel Kim's interview got millions of views. People are paying attention now. If we release these documents, if we show what Vance is doing, he can't hide behind classification. "That's treason," Lindholm said quietly. "Releasing classified DoD files. You could go to prison for decades. Better prison than complicity." Meredith started composing an email to Rachel Kim, attaching the files Evelyn had sent. Her hands shook slightly as she typed, but her resolve stayed firm. She'd spent 2 years running from the consequences of Kandahar. Time to run toward them instead. Before she could hit send, the conference room door burst open. Colonel Strassman stood there, flanked by 2 military police officers. Her expression was grave. "Captain Winters, I need you to put down the phone." "How did you—" "We monitor all digital communications involving recalled personnel. The moment your sister-in-law accessed those files, alarms went off across 3 federal agencies. Strassman stepped into the room. Don't send that email, please. Why? So Vance can keep running his human experimentation program? So more soldiers can die for his vendetta against me? No. So you don't destroy the investigation that's already underway. Strassman pulled out her own tablet and showed Meredith the screen. It displayed an official FBI case file. Subject: Senator Richard Vance. Status: active investigation. Charges pending: unauthorized human experimentation, misuse of federal funds, conspiracy. We've been building a case against Vance for 6 months, Strassman said. Ever since irregularities in the Medwar program started showing up in audit reports. But we needed proof, actual documentation of his involvement, evidence that connected him directly to the experimental protocols. And now you have it, Webb said, because Evelyn pulled the files. Exactly. Files accessed through official channels by an IG investigator, admissible in court, defensible under whistleblower protections. Strassman looked at Meredith. But if you leak them publicly, they become tainted evidence. Any defense attorney will argue they were obtained illegally, distributed without authorization, prejudice potential juries. Vance walks free. Meredith's finger hovered over the send button. Everything in her screamed to expose this immediately, to let the world see what had been done in her name, to burn it all down publicly and completely. But Strassman was right. Legal justice moved slowly, but it moved with permanence. Public outrage faded. Court convictions didn't. She deleted the email. What happens now? She asked. Now you report to Fort Lewis as ordered. You fulfill your recall obligations. You act like nothing has changed. Strassman's voice softened slightly. And you let the FBI finish their work. They're moving fast. Vance will be indicted within weeks, but they need you to stay quiet until then. And if I refuse? Then Vance finds out we're onto him, destroys evidence, intimidates witnesses, uses his Senate position to shut down the investigation before it reaches critical mass. Strassman paused. I know you want immediate justice, but sometimes the patient approach saves more lives. It was possibly the cruelest irony Meredith had ever faced. After fighting so hard to escape the military's control, she was being asked to voluntarily submit to it again. To walk back into Fort Lewis, to work under Blackwell's command, to pretend she didn't know about Vance's manipulation. To be invisible again, just long enough for the trap to close. Webb touched her arm. It's your choice. Whatever you decide, we've got your back. Meredith looked around the conference room at the faces watching her. Webb, Lindholm, Strassman. People who'd gone from dismissing her to defending her in the span of a week. People who'd proven that she didn't have to fight alone. I'll report to Fort Lewis, she said finally, but on my terms. I'm not pretending to be compliant. I'm going to make Blackwell's life a living hell. I'm going to question every order, challenge every protocol, and document every irregularity I find. Strassman almost smiled. That's acceptable. In fact, it's encouraged. The more pressure you put on Blackwell, the more mistakes he'll make. And the FBI is watching him very closely. Is Blackwell part of this? He's a facilitator, following Vance's orders through official channels. We need evidence of his direct knowledge. And you're our best chance of getting it. Strassman gestured to the military police. These officers will escort you to Fort Lewis. You're officially under protective custody pending your assignment briefing. Protective from what? From Vance. He's desperate enough to stage mass casualties for leverage. If he realizes we're investigating him, you become a liability he might try to eliminate. The words hung in the air like smoke after an explosion. Meredith had spent 2 years hiding from her past. Now she was walking directly into the crosshairs of someone who'd spent 3 years trying to destroy her. She stood. Let's get this over with. The drive to Fort Lewis took 90 minutes through pre-dawn darkness. Meredith rode in the back of an unmarked military vehicle, watching Portland's lights fade into rural highway. Webb had offered to come, but she'd refused. This part she had to do alone. Fort Lewis at 4 a.m. was eerily quiet. The base sprawled across thousands of acres, most of it sleeping. But the medical command building blazed with lights, as if the entire administrative staff was awake and waiting. They were. General Blackwell stood in his office, his uniform crisp despite the hour. Behind him sat 3 other officers, 2 colonels and a brigadier general, all medical command, all part of the apparatus that had been using her knowledge to build weapons. Captain Winters, Blackwell said. Welcome back. She didn't salute, didn't acknowledge the rank structure, just stood there, letting her presence speak for itself. Your first assignment is simple, Blackwell continued. You'll be teaching a 6-week intensive on combat trauma protocols at our Field Medicine Training Center. Your students are active duty medics rotating through advanced certification. What am I really doing here? Blackwell's eyes hardened. Teaching. You don't orchestrate 3 mass casualty incidents and force a recall just to have someone teach classes. What's the real assignment? That is the real assignment. Then you won't mind if I document everything. Every lesson plan, every protocol, every interaction with students. For my personal records. She watched tension ripple through the room, because documentation meant evidence, meant records that could be subpoenaed, reviewed, used to prove that her protocols were being taught in ways she never intended. Documentation is standard, Blackwell said carefully, though classified materials remain classified. Of course, she smiled without warmth. I wouldn't dream of sharing classified information, just like I'm sure you wouldn't dream of using classified information for unauthorized human experimentation. The Brigadier General shifted uncomfortably. One of the colonels cleared his throat. Blackwell's jaw clenched. You're dismissed, Captain. Your quarters are in Building 16. Report to the training center at 0800. Meredith turned to leave, but Blackwell's voice stopped her. Captain, a word of advice. The military has a long memory. People who make problems tend to find problems following them. She looked back at him. Is that a threat, General? It's a statement of fact. Then here's another fact. I'm not the person you remember. I'm not the scared combat surgeon who ran away after Kandahar. I'm someone who's learned that sometimes the only way out is through. She paused at the door. So bring your problems. I've been dealing with worse for 2 years. She left before he could respond. Her assigned quarters were small but functional, a single room with a bed, desk, and locker. Military standardization at its finest. She dropped her bag and sat on the bed, finally allowing herself to feel the exhaustion that had been building for days. Her phone buzzed. A text from Webb. You okay? Alive. Trapped. But alive. FBI wants to interview you. Strassman is arranging it. Might be your chance to give official testimony. When? Tomorrow. They're moving fast. Meredith lay back on the bed, staring at the ceiling. Somewhere in Washington, D.C., Senator Vance was probably sleeping soundly, convinced his plans were working perfectly. Convinced Captain Winters was finally back under control. He had no idea the trap was closing around him instead. She must have dozed off because suddenly her phone was ringing and gray light filtered through the window. 6 a.m. The caller ID showed a number she didn't recognize with a D.C. area code. Captain Winters? The voice was female, professional. This is Special Agent Victoria Reyes, FBI. I'm investigating the Medwar program and need to speak with you, today. Can you get to Seattle? I'm under military escort at Fort Lewis. I'm not supposed to leave base. Colonel Strassman is arranging your temporary release for medical consultation at Seattle, VA. You'll be picked up at 0900. Come alone. Don't tell anyone where you're going. The line went dead. Meredith stared at the phone. This was either the FBI moving to get her testimony or Vance's people moving to eliminate her. No way to know which until she committed. She got dressed, put on the civilian clothes she'd brought, and walked to the base entrance at 9 a.m. exactly. A black sedan waited outside the gates, unmarked but clearly federal. The driver was a young man in a suit who showed her credentials without speaking. Special Agent Torres, FBI. He held the back door open. She got in. The drive to Seattle took 40 minutes. They ended up at a nondescript office building downtown, the kind of place that could house accountants or lawyers or federal investigators without anyone noticing the difference. Torres led her to a conference room on the 8th floor where 2 people waited. Special Agent Victoria Reyes was a woman in her 50s with silver-streaked hair and eyes that had interrogated too many liars. Beside her sat a younger man introduced as Assistant U.S. Attorney Marcus Chen. Captain Winters, thank you for coming, Reyes said. We don't have much time. Senator Vance's staff requested a briefing on the Medwar program for this afternoon, which means he's getting nervous. We need your testimony recorded and secured before he realizes what's happening. What exactly do you need from me? Everything. Your combat service, the protocols you developed. The incident in Kandahar, your knowledge of the Medwar program and how it's been using your work. Reyes pulled out a recording device. This is your chance to tell the truth without filters. Without military command screening your words. Just you, under oath, explaining what's been done. Meredith looked at the recording device. This was the moment. The choice that would lock in consequences she couldn't undo. Before I start, she said carefully, I need to know what happens to the soldiers in the Medwar program. The ones who've been exposed, experimented on, used as test subjects. They'll receive full medical care, VA benefits, and compensation for their suffering, the prosecutor said, but only if we can prove the program was illegal. Only if we can show deliberate, unauthorized experimentation. Your testimony is key to that. And what happens to my protocols, the medical techniques I developed? They remain classified and legitimate. Your work saved lives. How it was misused is the crime, not the original innovation. She nodded. That was enough. For the next 4 hours, Meredith gave her testimony. Every detail of Kandahar, every manipulation she'd experienced over the past week, every piece of evidence connecting Vance to the Medwar program. She spoke until her voice was hoarse, until the coffee went cold, until every memory had been excavated and documented. When she finished, Reyes sat back with an expression of grim satisfaction. This is enough. Combined with the financial records and the testimonies we've been gathering from other soldiers, this puts Vance squarely in criminal territory. When will you arrest him? Soon. But Captain, you need to understand something. Once we move on Vance, he's going to lash out. He's going to try to discredit you publicly, to paint this as a vendetta by a disgraced military officer. It's going to get ugly. I've been preparing for ugly for 2 years. Not like this. Vance has power, connections, media relationships. He's going to attack everything. Your service record, your judgment in Kandahar, your mental health. He'll try to destroy you to save himself. Meredith thought about Marcus Webb calling her barely competent, about being dismissed and sidelined and treated like she was nothing, about 2 years of hiding who she was to avoid exactly this kind of fight. Let him try, she said quietly. I'm done being invisible. She returned to Fort Lewis that evening to find chaos. Word had somehow leaked that an FBI investigation was targeting the Medwar program. Officers were scrambling, documents were being shredded, people were calling lawyers. General Blackwell was in his office, his face ashen, when Meredith walked past. You, he said. You talked to them. I answered questions under oath. That's called cooperation with federal investigators. You should try it. You've destroyed everything. Years of research, billions in funding, programs that were saving lives, programs that were torturing soldiers. Her voice went cold. You want to talk about saving lives? I saved lives. You weaponized my work and called it research. He had no response to that. Over the next 72 hours, the dominoes fell with brutal efficiency. The FBI raided the Cascade Biomechanical Research Station, finding evidence of unauthorized human trials, falsified consent forms, and systematic ethical violations. 3 researchers were arrested, including the project director who'd approved Russell's exposure. General Blackwell was placed on administrative leave pending investigation. And on Thursday morning, federal agents appeared at Senator Richard Vance's Capitol Hill office with an arrest warrant. The news broke like a nuclear detonation across every media outlet. Senator arrested in military medical scandal, unauthorized human experiments, combat surgeon's testimony. Key to case. Meredith watched the news coverage from her quarters at Fort Lewis, seeing her face flash across the screen alongside Vance's. The story had everything: political corruption, military scandal, a whistleblower fighting back against the system. Her phone rang. Rachel Kim, Captain Winters, I'm getting requests from every major network for follow-up interviews. People want to hear your side of this. What do you want to say? Meredith thought about it, about 2 years of silence, about being dismissed and underestimated and forced to make herself small. I want to say that the system is broken, that soldiers deserve better than being treated as experimental subjects, that medical protocols developed to save lives should never be weaponized. She paused. And I want to say that I'm not hiding anymore. My name is Captain Ava Winters. I saved 200 soldiers in combat, and I'm going to keep saving lives. whether the military wants me to or not. The interview aired that night. By Friday morning, public opinion had shifted completely. Veterans groups were calling for military medical reform. Congress was demanding hearings. The Secretary of Defense announced a comprehensive review of all classified medical research programs. And Vance, facing multiple federal charges, resigned from the Senate in disgrace. It wasn't just justice, it was vindication. Meredith was in the Fort Lewis Medical Center, finally teaching the combat trauma class she'd been assigned, when Colonel Strassman appeared at the back of the room. After the class ended, Strassman approached. "Walk with me, Captain." They walked across the base grounds, past training fields and administrative buildings, not speaking until they reached a quiet area near the perimeter fence. "The investigation found something," Strassman said finally. "Something we weren't expecting." "What?" "The Medwar program had a secondary objective. Beyond just testing your protocols, they were developing something called adaptive triage AI. Artificial intelligence that could make medical decisions in combat scenarios based on your decision-making patterns." Meredith felt ice form in her stomach. "They were trying to replicate me?" "They were trying to replace human military surgeons entirely. Use AI to make triage decisions, to determine who lives and dies based on algorithmic analysis." Strassman's voice was grim. "The human experiments were training data. They were exposing soldiers to controlled injuries, documenting the outcomes, feeding it all into machine learning models." "That's insane. Triage isn't just math, it's judgment, context, human factors that can't be quantified." "We know. The program was fundamentally flawed, but Vance pushed it anyway because if it worked, it would revolutionize combat medicine. And it would retroactively prove that your judgment in Kandahar was replaceable, that any AI could have made better decisions." The final piece clicked into place. Vance hadn't just wanted to destroy her. He'd wanted to make her obsolete, to prove that human medical expertise was inferior to algorithmic precision, that his nephew's death could have been prevented if only they'd had better computers instead of fallible surgeons. "Did it work?" Meredith asked quietly. "The AI?" "No. Every simulation failed. Every real-world test produced worse outcomes than standard human triage. Turns out that judgment, experience, and intuition can't be coded." Strassman looked at her directly. "You were right, Captain. You were right about everything. And Vance destroyed himself trying to prove otherwise." They stood in silence for a moment, watching soldiers train in the distance. "What happens now?" Meredith finally asked. "With my recall?" "Technically, you're still under active duty orders pending the conclusion of the investigation. But given everything that's happened, I think we can arrange for you to return to civilian life. Full honorable discharge, all benefits reinstated, complete closure." "And if I don't want to leave?" Strassman looked surprised. "You want to stay?" "I don't know. Maybe. On my terms." Meredith took a breath. "I spent 2 years hiding from Captain Winters. Turns out I wasn't running from her. I was running from a system that didn't value her. But if that system can change, if it can actually care about the people it's supposed to protect," she shrugged. "Maybe there's work worth doing here. The consulting arrangement still stands. Half-time civilian, half-time military. Your choice where and how. I'll think about it." "Take your time, Captain. For once, nobody's rushing you." Meredith returned to Portland 2 days later. Riverside General welcomed her back with a standing ovation from the entire ER staff. Lindholm had held her position open. Webb had personally requested she be assigned to his surgical team as senior trauma specialist. But the person waiting in her apartment wasn't from the hospital. Staff Sergeant Davis Mitchell sat on her couch, looking older and more tired than the last time she'd seen him. "Ghost," he said. "Or should I say Captain?" "Mitchell, what are you doing here?" "I've got something you need to see." He pulled out a folder marked with classification stamps. "This is from the Medwar archive. Found it during the FBI raid. It's about Kandahar." Meredith's chest tightened. "I don't need to—" "You do. Because it's not what you think." He opened the folder and pulled out a photograph. It showed the field hospital from that night. Showed her working on the 3 wounded soldiers while the 4th, the senator's nephew, lay on a gurney nearby, a medic attending him. "Look at the timestamp," Mitchell said. She looked. The photo was taken at 23:47 hours. "The senator's nephew died at 23:51, Mitchell continued. which means you had 4 minutes with him, not 43. The after-action report lied about the timeline. Her world tilted. What? Someone altered the records to make it look like you worked on him longer than you did. Made it seem like you devoted extensive resources to him and still failed. Mitchell pulled out more documents. But the truth is, by the time you got to him, he was already gone. The other medic knew it. The trauma he'd sustained, no surgeon alive could have saved him. Then why lie? Because if the official report said he was unsavable, there's no controversy, no inquiry, no political scandal. But if it said you worked on him for almost an hour and he still died, Mitchell shook his head. That creates doubt, creates questions about whether you made the right call prioritizing the others. Meredith sat down slowly, the implications spreading like fault lines through everything she'd believed for 2 years. She'd been carrying guilt for a failure that wasn't hers, had run from a judgment that was based on fabricated evidence, had let a lie destroy her because she'd never questioned the official narrative. Why would they falsify the reports? She asked quietly. Because Senator Vance demanded answers, and the military gave him the answer he wanted to hear, that someone was responsible for his nephew's death, that there was a failure point, a wrong decision, a person to blame. Mitchell's voice was bitter. They threw you to the wolves to satisfy a politician, and you never fought back. I didn't know. None of us did, not until the FBI started digging. He stood. Ghost, Ava, you spent 2 years thinking you failed that kid. You didn't. The system failed him, and then it failed you. After Mitchell left, Meredith sat alone in her apartment with the folder of evidence. She'd spent so long running from Kandahar that she'd never stopped to question whether the version of events she remembered was even real. It wasn't. The guilt she'd carried was built on lies. The judgment she'd accepted was manufactured. The failure that had broken her was fiction. She'd been Captain Ava Winters, combat surgeon, lifesaver, decorated officer. And they'd taken that from her with falsified paperwork and political pressure. But she'd taken it back, not by becoming Meredith Cole, not by hiding, but by fighting, by exposing the truth, by refusing to disappear. Her phone rang, an unknown number. She answered. Hello? Captain Winters, this is General Kara Hernandez, Army Surgeon General. I'm calling to formally apologize on behalf of the United States Army Medical Command for what was done to you after Kandahar. The falsified reports, the political pressure, the professional retaliation, all of it was wrong, and we're committed to making it right. Meredith closed her eyes, feeling 2 years of tension finally begin to release. Thank you, General. We'd like to offer you a permanent position as Chief Combat Medicine Instructor at Fort Lewis. Full rank reinstatement, command authority, complete autonomy over curriculum. You'd be training the next generation of combat surgeons using your real protocols. Not weaponized versions, not experimental variations, but the actual techniques that saved 200 lives. And if I say no, then you say no. This is an offer, not an order. You've earned the right to choose your own path. Meredith looked around her apartment, at the bare walls she'd never decorated, at the boxes she'd never unpacked, at the life she'd been living in limbo for 2 years, neither fully civilian nor fully military, just suspended between identities. I need time to think about it, she said. Take all the time you need, Captain. We're not going anywhere, and neither are you, not anymore. The call ended. Meredith walked to her window, looking out over Portland's nighttime skyline. Somewhere out there, Marcus Webb was probably finishing a surgery. Angela was starting her night shift. Lindholm was reviewing patient charts. The machinery of Riverside General continuing its endless cycle of crisis and healing. And somewhere in Washington, D.C., Senator Richard Vance was sitting in a cell, finally facing consequences for the lives he'd destroyed in the name of proving himself right. The story should have ended there. Justice served, truth revealed. Captain Ava Winters vindicated and free to choose her future. But the next morning, her phone rang with a number that made her blood run cold. Cascade Biomechanical Research Station, the facility that had been raided. That was supposed to be shut down. She answered. Hello? Captain Winters. The voice was male, unfamiliar, clinical. My name is Dr. Lawrence Kemp. I was the lead researcher on the Medwar program before federal agents destroyed 3 years of critical work. If you're calling to threaten me, I'm calling to inform you that Senator Vance was a fool who understood nothing about what we were actually building. The AI triage system was a cover story for politicians. The real program was something far more valuable. I'm hanging up. The real program was a complete neural map of your medical decision-making processes. Every choice you made in combat, every protocol you developed, every instinct you followed, we documented all of it, captured it, and before the FBI arrived, we backed it up to secure servers outside federal jurisdiction. Meredith's hand tightened on the phone. What are you saying? I'm saying that Captain Ava Winters is now reproducible. Your expertise, your judgment, your combat medical protocols, all of it exists in digital form. And there are organizations willing to pay billions for that data. Private military contractors, foreign governments, anyone who wants the best combat medicine in the world without having to negotiate with the person who created it. That's illegal. That's theft of intellectual property. And that's the future, Captain. You spent 2 years hiding from who you were. We've ensured that who you were can never disappear. Your legacy isn't yours anymore. It belongs to whoever purchases the data. The line went dead. Meredith stood frozen, her mind racing. Everything she'd fought for, her autonomy, her right to choose how her knowledge was used, her control over her own identity, had been stolen, digitized, weaponized in a way she couldn't fight with testimony or FBI investigations. Captain Ava Winters existed in code now, immortal, uncontrollable, available to the highest bidder. And somewhere out there, Dr. Lawrence Kemp was selling her piece by piece to anyone willing to pay. Meredith called Agent Reyes before her hand stopped shaking. We have a problem. Within 3 hours, she was back in the Seattle FBI office with Reyes, the prosecutor, and 2 cybercrime specialists who looked like they hadn't slept in days. Dr. Kemp disappeared 48 hours before we raided the facility, one of the specialists said, pulling up surveillance footage. He knew we were coming, walked out with encrypted drives containing the entire MedWar database. Can you track the data? Meredith asked. We're trying. But he used military-grade encryption and routed it through servers in 7 countries. Even if we locate it, seizure would require international cooperation that takes months. We don't have months. Reyes looked at Meredith. If Kemp sells that data to private contractors or foreign governments, we're looking at a national security catastrophe. Your protocols in the wrong hands could save lives or end them, depending on who's using them. Meredith's mind was already working through options. But there's something Kemp doesn't understand. Medical protocols aren't just data points. They're contextual. They require judgment, adaptation, human factors. An AI or a foreign surgeon trying to use my techniques without understanding the underlying principles will fail, probably catastrophically. Can you prove that? Better. I can demonstrate it. An idea was forming, dangerous but necessary. Kemp thinks he stole my expertise. Let him try to sell it. And when his buyers discover they've purchased incomplete data that doesn't work without me, the market collapses. Webb appeared in the doorway. Reyes had called him too. You want to sabotage your own protocols? Make them look ineffective? No. I want to prove they're inseparable from the person who created them. That medicine isn't code, it's human. Meredith stood. Kemp's data shows what I did. It doesn't show why. Without that context, it's worthless. The prosecutor leaned forward. What are you proposing? We let Kemp make his sale, but we ensure his buyers test the data publicly. Military medicine conferences, academic demonstrations, peer-reviewed trials, and we document every failure, every case where the protocols don't work without human adaptation. She paused. We turn his theft into proof that some expertise can't be stolen. It was risky. If it backfired, Meredith's reputation would be destroyed. People would think her methods were fundamentally flawed. But if it worked, it would expose Kemp and collapse the market for stolen medical data simultaneously. Reyes considered for a long moment. We'd need cooperation from Military Medical Command, full transparency about the MedWar program, about what was stolen, about the limitations of the data. I can arrange that, Webb said. General Hernandez already owes Ava a massive debt. She'll help. The operation moved with brutal speed. General Hernandez agreed immediately, seeing the larger implications. If military medical expertise could be stolen and sold, no combat surgeon was safe. Better to expose the vulnerability now than wait for it to metastasize. Within a week, word leaked through intelligence channels that encrypted MedWar data was available for purchase. Multiple interested parties emerged: private military corporations, overseas medical research programs, even a few legitimate hospitals looking for competitive advantages. Kemp took the bait. He arranged a demonstration sale through intermediaries, offering to prove the data's value through a live surgical scenario at a private medical facility in Singapore. The FBI coordinated with international law enforcement, and Meredith booked a flight. She arrived in Singapore to find the demonstration already in progress. A surgical theater filled with potential buyers, all watching as a team of surgeons attempted to use her protocols on a complex trauma case, a controlled scenario designed to showcase the data's effectiveness. The surgery was failing, not because the protocols were wrong, but because the surgeons were applying them mechanically, following steps without understanding the underlying reasoning, making choices by checklist rather than judgment. Meredith watched from the observation gallery as the patient's vitals deteriorated, watched the surgical team scramble, consulting Kemp's data files, trying to find the next step in the algorithm. "They're missing it," Webb said beside her. He'd insisted on coming. "The tissue's responding differently than the data predicted. Any experienced surgeon would adapt, but they're treating it like code that can't be changed." "That's the point. Medicine isn't programming. It's improvisation within structure." Meredith pulled out her phone and texted Agent Reyes, who was coordinating with Singaporean authorities. "They're ready. Move now." The doors burst open. Local police, FBI liaisons, Interpol agents. The surgical theater erupted into chaos. Potential buyers scattered. The surgical team froze. And standing at the back of the room, trying to slip out a side exit, was Dr. Lawrence Kemp. Singaporean police caught him before he reached the door. The patient on the table was stabilized by local trauma surgeons, real experts who knew how to adapt when protocols failed. The demonstration's failure was documented. Every potential buyer had witnessed that stolen data without expertise was worse than useless. Kemp was arrested on charges of industrial espionage, theft of government property, and international trafficking in stolen data. The servers containing the Medwar database were seized across 7 countries simultaneously. And Meredith stood in the observation gallery, watching justice arrive 30,000 miles from where it started. The flight back to Portland took 18 hours. Meredith spent most of it sleeping, finally letting her guard down after weeks of constant crisis. When she woke over the Pacific, Webb was watching the news on his tablet. "You're trending again," he said. "The Singapore story broke. Military surgeon stops international theft of medical data. People are calling you a hero." "I'm just someone who got tired of being stolen from." "That's what heroes are. People who get tired and decide to fight back anyway." He closed the tablet. "So what now? You've got a job offer from the Army, a position at Riverside, and probably a dozen other opportunities. What does Captain Ava Winters do next?" She looked out the window at the clouds below, thinking about the question. 2 years ago, she'd tried to stop being Captain Ava Winters, had run from the weight, the expectations, the impossible choices that came with expertise, but running hadn't freed her. It had just made her smaller. "I think Captain Ava Winters stops letting other people define her," she said, finally. "I'm taking the Army's offer. Half-time at Fort Lewis, training combat medics. The other half at Riverside, working trauma. No more hiding who I am. No more pretending to be less capable than I know I am." "That's going to be exhausting." "Probably. But I've learned something these past few weeks. Being invisible doesn't protect you. It just makes you easier to manipulate. Better to be visible. Better to take up space. Better to be so undeniably competent that people have to deal with you on your terms." Webb smiled. "The nurses at Riverside are going to love having you back, especially since you're going to make my life hell whenever I get arrogant." "That's the plan." They landed in Portland to find a crowd waiting at the airport. Not press. Staff from Riverside General, holding a banner that read, "Welcome home, Captain Winters." Angela was there, and Lindholm, and dozens of others who'd worked alongside her. Mitchell was there too, in uniform, standing at attention. "Welcome back, Ghost," he said. "For real this time." The return to Riverside felt different than her first day 6 weeks earlier. Then, she'd been invisible, deliberately small, trying to disappear into the background. Now she walked through the ER with her head up, her real name on her badge, her military rank acknowledged. Marcus Webb introduced her at morning rounds not as a trauma nurse but as Dr. Ava Winters, combat medicine specialist and senior surgical consultant. Dr. Winters will be working alongside our surgical team, he told the residents and staff. Her expertise in field trauma is unmatched. Her judgment is something you should all aspire to, and if any of you treat her with anything less than the respect she's earned, you'll answer to me. It was possibly the most sincere apology Meredith had ever received. 6 months later, she stood in front of a classroom at Fort Lewis, looking at 40 combat medics who'd come from 3 different branches of service for advanced trauma certification. Some of them had heard stories about her. Some had been skeptical, just another instructor with more credentials than real experience. She let them think that for exactly 5 minutes. Then she walked them through a trauma scenario. Multiple casualties, limited resources, impossible choices. Made them work through triage decisions. Watched them struggle with the math of who lived and who died. Medicine isn't just science, she told them when the exercise ended. It's not protocols you memorize and apply mechanically. It's judgment developed through experience, through failure, through carrying the weight of every choice you make. You can learn the techniques, but wisdom? That comes from doing the work. From saving the lives you can save and mourning the ones you can't. A hand went up. Young kid, maybe 22, nervous. Captain, is it true you walked away from the military after Kandahar? Yes. Why'd you come back? Meredith considered the question. The real answer was complicated. Manipulation and pressure and circumstances beyond her control. But the deeper truth was simpler. Because hiding doesn't work. Because being small doesn't protect you. Because the only way to survive in a system that wants to break you is to be so undeniably valuable that they have to respect you on your terms. She paused. I spent 2 years trying to disappear. It was the most miserable 2 years of my life. Not because I was in danger, but because I was denying who I was. The work I could do, the lives I could save. She looked around the classroom at faces that would deploy to combat zones, that would face the same impossible choices she'd faced. You're going to make mistakes. You're going to lose patience. You're going to have moments where you question every decision you've ever made, and the system will try to break you for it. Will demand perfection, will punish failure, will make you feel like you're never enough. Her voice hardened with certainty. But here's what I learned. Your value isn't defined by the people who dismiss you. It's defined by the lives you save when everyone else has given up, by the expertise you build through experience, by refusing to be invisible when the world wants you to disappear. The classroom was absolutely silent. So learn the protocols, master the techniques, build your skills until they're unshakable, and then use them without apology. Because combat medicine isn't about being perfect, it's about being present when everything's falling apart and still finding a way to save lives. Class ended. The medics filed out, some of them looking thoughtful, some of them looking inspired. Mitchell waited until they'd all left before approaching. Hell of a speech, Ghost. It's the truth. I know, that's what made it powerful. He handed her a folder. This came through official channels. Thought you should see it before it goes public. She opened it. Inside was a formal commendation from the Army Surgeon General, recognizing her service in combat zones and her role in developing trauma protocols that had saved countless lives. But more than that, it included a formal apology for the falsified reports after Kandahar, for the professional retaliation, for the systematic failures that had driven her from service. They're putting it in your permanent record, Mitchell said, making it official. Captain Ava Winters didn't fail in Kandahar. The system failed her. Meredith read the document 3 times, feeling 2 years of guilt finally dissolve. Not because someone else had said she was innocent, she'd always known that, but because the institution that had broken her was finally admitting its fault. That evening, she returned to Portland and walked into Riverside General for her shift. The ER was chaos as usual. A car accident, a cardiac event, a construction injury that had turned a worker's hand into something requiring reconstructive surgery. She moved through it all with the same efficiency she'd brought to combat zones. The same judgment, the same refusal to accept that anyone was beyond saving. Around midnight, a code blue alarm shrieked through the hospital. Meredith ran toward the sound and found a young surgical resident frozen in panic, staring at a patient who'd just arrested on the table. Move, Meredith said, not unkindly. She took over compressions, called for medications, orchestrated the response with practiced calm. The patient's heart restarted after 90 seconds. The resident was shaking. I froze. I knew what to do, but I just... It happens. You'll do better next time. Meredith stripped off her gloves. First code? Yes. Then you're ahead of schedule. Most people freeze on their third or fourth. You got it out of the way early. The resident managed a weak smile. How do you stay so calm? Practice. And accepting that fear is part of the job. The secret isn't not being afraid, it's not letting fear make your decisions for you. She left the resident to recover and found Webb waiting in the hallway. That was impressive. That was Tuesday, he laughed. You know what I realized? 6 months ago, I thought you were barely qualified. Now I think you're the most qualified person in this building. How did I miss that? Because I was hiding and because you weren't looking. She paused. But we both learned something valuable. You learn not to judge people by surface impressions. And I learned that hiding doesn't protect you. It just prevents people from seeing what you're capable of. So no more hiding? Never again. They walked back to the ER together, ready for whatever the rest of the shift would bring. Years later, when people asked Captain Ava Winters about the week that changed her life, she never told the full story. Never mentioned Senator Vance's vendetta, or the stolen data, or the careful orchestration that had tried to destroy her. Instead, she talked about choice, about how she'd spent 2 years choosing invisibility and found nothing but emptiness. About how the moment she chose to stand up, to fight back, to take up space without apology, that's when everything changed. People will try to make you small, she'd tell her students at Fort Lewis, her colleagues at Riverside, anyone who asked. They'll dismiss your expertise, question your judgment, demand you prove yourself over and over, and you'll be tempted to make yourself smaller to fit their expectations, to hide who you are to avoid their scrutiny. She'd pause, letting the words land. Words, don't. Be undeniably competent. Be unavoidably present. Be so good at what you do that they have no choice but to respect you on your terms. Because the world doesn't need more people making themselves small. It needs experts who own their expertise, healers who refuse to hide, people who understand that visibility is power. And in the trauma bays of Riverside General, in the training classrooms at Fort Lewis, in the lives saved by protocols she'd developed and the medics she'd trained, Captain Ava Winters proved that truth every single day. Not by being perfect, not by never failing, but by refusing to disappear when the world wanted her gone. The nurse everyone ignored became the surgeon no one could overlook. And justice didn't just close the wounds of her past. It opened doors to a future where she'd never have to hide again.